Welcome to this online event, COVID-19, Occupational Health and Safety for Health Workers. The objective of this event is to present the interim guidance of the World Health Organization and International Labour Organization, and to discuss the main challenges which Ukrainian healthcare workers face in the times of the pandemic, the, the response measures, and to see how this interim guidance can help improving health and safety of health workers. Also, to draw attention to the importance of the development and implementation of national occupational health program for health workers. After this seminar, we will outline the main challenges for health and safety of health workers. We will learn about the content of the interim guidance, which would hopefully be very useful in finding the solutions to these issues and to discuss the perspectives of the national occupational health programs um, with people who take political decisions. The participants of this webinar are the specialists from the Ministry of Health of Ukraine, regional healthcare authorities, the heads of units responsible for occupational health and medical facilities, and others. Also, we have representatives of state labor service and other authorities of Ukraine, national and sectoral trade unions and associations of employers, and the representatives of World Health Organization and International Labour Organization. Now, I would like to ask our technical support guys to uh, show the address of Dr. Tedros Ghebreyesus, the head of the World Health Organization, to the global ILO.
Director General Guy Ryder, Excellencies, colleagues, and friends. More than 136 million people are employed in the human health and social sector. All of them have the right to decent working conditions and protection of their health and safety. This is even more important in a public health crisis. Health systems, jobs, livelihoods, and the economy are intertwined. COVID-19 infections and deaths among healthcare workers continue to occur. I want to pay special tribute to the heroes who have lost their lives while doing their job of caring for patients. We call on countries to put in place decent occupational health programs and infection prevention and control in all health facilities, big and small, public and private, in cities and in villages. Together with the International Labour Organization, WHO has issued guidelines for protecting health workers' safety, as well as manuals for workplace improvement in health services and occupational safety and health in public health emergencies. WHO calls on governments, employers, and workers' organizations in the health sector to develop strong and sustainable national programs for occupational safety of health workers. More than 50 countries have already implemented such programs and demonstrated the benefits in public health emergencies. Together, we have a duty to protect those who protect us. I thank you, and I wish you a productive discussion.
I would like to give the floor to the WHO country office representative in Ukraine, the WHE lead, Mr. Guillaume Simonian. Guillaume, the floor is yours.
Thank you, Georgi. Good morning, colleagues. I'm very pleased to be with you today. And I will start with a small anecdote. I've been around the world in various emergencies, various conflicts. What we see of those conflicts, of those massive disasters that have been happening in the last decades, is always the guns, the planes, everything that you see on CNN. But what you don't see is there is always, whenever there is a patient in need of care, there is always very dedicated medical workers which are there on the front if it's a conflict, right next to the rebels if it's an earthquake, right next to the exploded factory if that's an exploded factory, right next to where the epicenter of the epidemic is when it is about an outbreak response. And I've seen that all across the world, in Syria, in Libya, in Turkey during the earthquake, in Iran during the earthquake, when big factories were exploding in India, in the DRC, in the middle of a conflict for the Ebola response. And always, as Dr. Tedros was saying, there are those untold heroes, medical workers, which are there to do their job. And your job, our job, is basically to save lives and to ensure that the patients are there to get the care that they need for. And during this COVID-19 pandemic, it has unveiled enormous challenges for protecting the health, the safety, and the well-being of our health workers. This war, if you wish, is not the same as the war that we see on CNN usually. There is no planes, there is no guns, there is no visible enemy. But there is an invisible enemy, which is this virus, on which we are all fighting against as a united humankind. And the real heroes, the real frontline workers are the healthcare workers. The healthcare workers are also paying the highest toll to the virus. Globally speaking, if we speak of statistics, less than 3% of the population have contracted COVID, but globally, around healthcare workers, 14%, 14% of the COVID-19 cases are reported amongst healthcare workers. It's really disproportionate. And it's because you are on the front line. You are always with the patients. You are always close to the virus. You are always close to this untold and visible enemy. And in some countries, this proportion can be as high as 35%. It's something WHO was working very hard at the beginning of this pandemic to ensure that the infection prevention and control measures in the hospitals are there to protect the healthcare workers as the first line responders to the crisis. And in Ukraine, unfortunately, more than 66,000 healthcare workers have fell ill during the pandemic, and many have lost their lives as well. As Dr. Tedros was saying, heroism is a daily happening, and in your daily life as healthcare workers, you have been heroes, and fellow healthcare workers all across the country have been heroes. So being on the front line of the COVID-19 response is making a high exposure to the occupational hazards that the virus is causing. There is a risk of illness. There is a risk of even injury. We have seen that all across the world, including in Ukraine, of unsatisfied patients, families, close relatives, which are fearing for the lives of their close ones, which are critically sick. And sometimes this anger is projecting against the healthcare worker, which is close to the person and which is trying his or her best to treat the patients. So there is also a risk of injury from that type of threats. And there is a risk of death. We should not hide it. So reducing those risks and protecting the health, the safety, and the well-being of the healthcare professionals is crucial. It's one of the first things that we should think about when developing this outbreak response further. It requires coordination. It requires comprehensive measures for prevention and control, as I mentioned at the beginning. and also for the occupational safety and health of the healthcare workers. It requires human health management, because there is a human component to that, on how the hospital management is being developed in a sense of having a very long crisis with the fatigue, the burnouts, and all of those associated risks which are there for long hours, for a very long period of time. And mental health. Mental health is very important. Healthcare workers are more stressed now than any other segment of the population because of this virus. So all of this support has to come together to ensure that the society as a whole, the government in particular, is putting attention to the real heroes of this fight. So that's why 2021 has been designed as the International Year of the Healthcare Workers, in appreciation and gratitude for the dedication of the healthcare workers in the fight against the virus. WHO, as an organization, has decided to do a year-long campaign. So we are all within a long emergency response, but we have also to have a year-long dedication to the theme of protect and invest in the healthcare workers. So we are together, and it highlights the urgent need to invest in healthcare workers for the shared dividends that the healthcare workers project, as Dr. Tedros was saying, not only on the health and public health dimension of the response, but also in maintaining jobs, in ensuring economic opportunities are there for all, in making sure that equity is behind everything that we do in the healthcare sector. So this year, we are calling on the support and action by everyone to ensure that all health workers are supported, are protected, are motivated, and are equipped to deliver to self-health care at all times. So all working people, not only healthcare workers, by the way, and the colleagues from the ILO do that on a daily basis, have a right to decent, healthy, and safe working conditions. It's the true for all workers. It's especially true for healthcare workers in COVID times. So healthcare workers should not be an exception. So the COVID-19 pandemic has unveiled systematic lack of measures for healthier and safer working conditions in the health sector. It highlighted also the extent to which protecting healthcare workers is really key to ensuring a functioning health system, a functioning society, and towards a functioning economy. So by this webinar, we would really like, as WHO and ILO, to present and promote the practical use of the recent guidance that was developed jointly by WHO and ILO on occupational health and safety for healthcare workers in the context of COVID-19. And we would like to discuss the key challenges in Ukraine and the key challenges in this response, the key challenges as a whole for the right of workers and right of healthcare workers, and to define how this interim guidance can help to improve occupational health and safety of all healthcare workers in Ukraine. In addition to that, and I will conclude there, we would like to emphasize that it is very important to formulate and implement a national program for occupational health and safety of healthcare workers. And we hope that we will get there in the course of today and follow up with our colleagues from the government of Ukraine and from the International Labour Organization into this very important effort to make sure that our heroes, the healthcare workers, are protected and with the due respect and attention that they deserve. So thanks very much, and giving you back the floor.
Thank you so much, Mr. Simonian. Next, I would like to give the floor to the ILO National Coordinator for Ukraine, Mr. Sergei Savchuk. Thank you. Thank you, Mr. Chair.
I would try to fit in the 5 minutes that have been allocated to make my welcoming remarks, but also I will try to allow myself few reflections that I hope will introduce us to the discussion. Let me allow myself, few reflections, colleagues, which I hope will serve as introduction to the discussion. So today, dear colleagues, we stand approximately a year since the WHO announced the COVID-19 pandemic. It has been already said that it hit hard the Ukrainian economy, businesses, and put unprecedented pressure and burden on healthcare workers who stand in the epicenter of the pandemic, protecting our lives and sometimes paying the higher price of their lives. So healthcare workers, and I think this has already sounded today during Guillaume's introductory remarks, also need support and protection. But have the measures taken thus far been effective enough to protect the healthcare workers? Well, the answer to this question is not easy. There have been many instances of great support by the international organizations, the government, the private sector, employers and workers organizations did their part, and many individuals, and this deserves appreciation. This is a lot, but this is definitely not enough. There have been long-standing issues in the public health sector exacerbated by COVID. The recent briefing note published by the Human Rights Monitoring Mission in Ukraine, which was prepared with the ILO support and support from the trade unions in the healthcare sector, captured appalling lack of healthy and safe working conditions for health workers, in particular due to lack of sufficient personal and collective protective equipment, effective infection prevention and control mechanisms in the workplace, and mental health and psychological support services. Healthcare workers also suffer from increased workloads and insufficient time for rest. They also lack social protection. Out of more than 60,000 cases of healthcare workers infected by COVID-19, only a small percentage have been recognized as work-related, impeding the workers' right to compensation. In some cases, the healthcare workers who died out of COVID-19, in order for the family to get a compensation, it had to be elevated to the highest political level of the country. Today's presentation of the joint WHO and ILO interim guidance is one important step, of which careful application may lead to safer and healthier working environment for healthcare workers, and consequently for their patients and for the society in general. I should commend the Ministry of Health, the State Health Service, State Labor Service, health sector trade unions and employees organizations, and our colleagues from WHO, my fellow ILO colleagues, for their support and engagement in this initiative. This guidance provides technical and practical advices and information on how to improve the safety and health of health workers in the current COVID-19 pandemic context. I hope that today's discussion will boil down measures which will inform the national OSH program for the healthcare workers in Ukraine. This tool, however, is an element to an entire occupational health and safety system, which should in fact work as an ecosystem. The OSH ecosystem can't operate properly if the legal framework doesn't create an enabling environment for this ecosystem to exist. In this regard, a tectonic transformation needs to be made from a system based on a reactive approach to hazards, accidents, diseases, or crises towards a system based on preventive approach and risk management, which mean risk avoidance, assessment, and control. We can only welcome the initiative of the government of Ukraine and the Ministry of Economy in particular to move forward with the development of the draft law on occupational safety and health of workers. At the same time, based on international labor standards and EU-Ukraine Association Agreement, we can't abstain from mentioning that the national legislation has to be fully aligned with that of the European Union, starting first and foremost with the EU OSH Framework Directive 89/391, which in fact creates conditions for such ecosystem to exist, and it lays down the foundations on which the entire OSH architecture can be built. I'm taking this opportunity to draw the attention of policymakers to the wealth of technical comments prepared by the ILO in this regard, and to make a good use of them. The second thing I would like to reiterate is the ongoing labor law reform and the growing trend of replacing de facto labor relations with the de jure civil relations. Let me remind all of us that the employers' legal obligations to provide healthy and safe working environment for workers emerge from the labor law, while the civil law de facto workers, under the civil law, de facto workers should take care of their safety and health on their own. Usually seen as optimization of taxation or easing the burden on businesses, these practices have far-reaching consequences: less protection, more hazardous working environment, dropout from the social protection safety nets, and poverty. COVID-19 brought these consequences to the extreme and calls for policymakers to weigh dangers these new trends bring in terms of safety and security of the working people, including the healthcare workers. I think we all agree here that the working conditions of healthcare workers do not only affect their own rights, but also impact the rights of health service users, meaning of all of us, including our access to quality health services. Finally, let me close by saying that Ukraine has got the keys to better protection of lives and well-being of the Ukrainian workers and healthcare workers in particular. And these keys are the international and EU standards in the area of labor relations and OSH. They need to be aligned with and duly implemented. Let me assure you that ILO will be there with you each step on the way, using these keys to open the doors leading towards creating the workplaces that are safe and healthy. I thank you for your attention.
Дякую, пане Сергій. Дякую, колеги.
Thank you, dear Sergey. Thank you, dear colleagues. Now, coming back to our agenda, we are switching over to session 1 of our workshop, which will be dedicated to the key challenges and the matters of occupational health and safety for health workers, interventions and response measures. First of all, let me once again remind all of the participants of our webinar that you will have opportunity to ask questions to the speakers and presenters, but the core session subsection for questions and answers will be facilitated at the end of this section, so please be mindful of that. Let me offer the floor to the Chief of Director for Occupational Safety and Health, Alexander Ignatov. Mr. Ignatov, you're welcome. Good morning, my dear colleagues. Indeed, it's been more than a year when the list of hazards has been extended with another bullet point, which is highly hazardous, and that is COVID-19. Today, we are going to discuss the key challenges that Ukrainian workers, and particularly healthcare workers, are facing in Ukraine. And as all we appreciate, it's not just a matter of infection of healthcare workers, but sometimes having major disease outcomes such as lethality. And that may also be associated not only with the medical staff, but also with other people employed by the clinical facilities. Definitely, there are so many different technicalities to be discussed in terms of COVID-19 threat response. First and foremost, that would be the safety precautions in using the oxygen supply equipment, which is life-saving therapy for the COVID-19 patients. That means using networks, manifolds, containers, and other core and supportive equipment. The relative safety instructions have been developed and distributed to all of the respective occupational health officers, and we are always collecting the response and feedback from the field officers. I was particularly involved in field testing of such systems. But ironically enough, sometimes we can't have all of those provisions and precautions made available, including the occupational safety precautions, and that's where awareness raising, due diligence, training and enforcement should also be supporting installation and service of such systems, particularly with the growing needs on the use of oxygens within the healthcare system and elevated risk both for the staff and for the patients. By the way, looking into the recent days, the average consumption within the Kyiv city alone exceeds 40 tons of oxygen per day. This is a tremendous amount. Relying on the best modern communications and data exchange systems and methodologies, we can monitor the situation and react promptly to all of the inappropriate actions and operations which are admitted by the local staff in order to improve the situation in different regions of Ukraine. Addition to that, we provide consultations and advice to healthcare facilities. We involving and by occupational safety officers to ensure and sustain safe use of oxygen supply equipment. Our preventive measures have identified some of the potential risk areas and hazards, primarily lack of the sufficient service and maintenance staff who has the relative training and qualifications to use such equipment, then use of oxygen tanks with violation of some elementary precautions. Healthcare administration in on-site, including the clinical management, sometimes making unsatisfactory level of precautions to prevent accidents in use of oxygen supply equipment. And these are some of the additional challenges which put health workers at risk, and thus negligence and paying insufficient attention both to such precautions but also operational use, due service and maintenance of the equipment might also be hazardous to everybody else in the environment with some adverse results. As an example, on February the 3rd, Kharkiv Infectious Disease Hospital had fire accident with 4 people who died. One of them was a doctor, 26-year-old. 2 more healthcare workers were injured in this accident. Turkey, 12th of December last year, 9 people died because of CPAP unit exploding within the intensive care department. And such accidents are multiple across the globe: Russian Federation, Brazil, Algeria, and that is clearly emphasizing the importance of making the tangible contribution to safe environment of health workers. And that's where prevention is the key tool to be applied, as well as awareness raising, promotion and training on occupational health and safety. So with that, thank you for your attention and being mindful of the time. Let me save more time for the sake of discussions further on. Thank you so much, dear Sergey. And with that, let me invite to the floor Madam Lyudmila Kharchuk, the Chief of Department for Occupational Health and Safety and Workplace Inspection, State Labor Service of Ukraine. Good morning, dear participants. I'm happy to welcome all of you to our extremely important event today, because healthcare workers today indeed are those heroes in the front line who put their life to protect our health and our lives, and thus we have to sustain all the necessary precautions and concerns. First of all, our inspectorate implements quite an intensive awareness-raising promotion agenda about occupational hazards, risk and infections, primarily focusing on the healthcare sector of Ukraine. Every local jurisdiction and local oblast administrations have elaborated comprehensive plans for mitigation of the COVID-19 effects among healthcare workers. But as of April 14th, current year, since the start of the pandemic development in Ukraine, we totally registered 78,919 cases of coronavirus disease among health workers and other members of staff of healthcare workers, with 38,000 plus being resulting in lethality. Totally, we have received 46,751 reports about the COVID-19 cases, and most of them are coming from Kyiv, Lviv, Kharkiv, and Dnipropetrovsk Oblast. Going to slide number 4, we can see the broken down information looking into the type of professions and affiliation which would be primarily affected. So that would be the fellows, nurses. Looking into the clinical positions, we have primary care clinicians, family clinicians, amounting to the majority of 2,346. Looking into the mortality reports, we have 625 cases under investigation, with the majority coming from Lviv, Kharkiv, Dnipropetrovsk and Kyiv Oblast. Local authorities have established special investigation commissions to look into such incidents. Using the expedited methodology, which was initiated in January 2021, healthcare facilities are investigating overall 75 cases at the moment involving lethality cases among healthcare providers, which is done in close collaboration with the Labor Inspectorate, additionally to independent investigations. Local labor inspections, jointly with healthcare authorities, have completed 21,749 case investigations, including 5,743, which was involving a labor environment, while in other cases, such causality assessment did not find the direct link between the labor environment and the cause or outcome of the disease. In many cases, such investigations rely on the timely and full epidemiological investigation to be done with a laboratory center support, while our epidemiological investigations are not done within the required time frame, and in some cases we cannot clearly identify the source, and the causality assessment thus cannot be performed as part of that investigation, including the unavailability of some of the medical reporting documentation, and thus it is impossible to establish the links to the environmental factors involved, including the labor environment factors. And that is why, looking into the current number of investigations, most of them had to be extended because of appropriate submission of the findings of epidemiological investigation response, as well as autopsy report or epidemiological investigators. And thus, despite the fact that we have the standing regulations for conducting such joint investigations, and sometimes there is a dispute about the primacy of the respective regulatory framework. This document is the instruction about the use of the list of occupational diseases, which clearly stipulates that any disease of infectious origin of occupational nature should be confirmed by the epidemiologist looking into the reports of the occupational safety officer, as well as epidemiological specialist who should contribute to such joint investigation. Going to slide number 7, we can see information about the completion of 438 cases of mortality investigation, following the results of which 149 cases were found as directly associated with occupational risk, while in the others this was rejected. Individual investigations done by healthcare authorities was applied in 149 cases, and 16 cases only when such causality relationship was not established. Looking to the results and of the consolidated statistics, we have identified the key reasons and causes, with the organizational causes being in the leading position, primarily inappropriate use of personal protection equipment when available, while in the another problem associated with that would be lack of supply of PPEs and their availability. Then psychological and physiological causes, where the prevalence of personal factors is involved, while psycho-emotional and physiological burnout effects when dealing with highly contagious infections, particularly associated with people involved in intensive care units and who have excessively high working load and even the burden of professional workload. Technical reasons such as inappropriateness of the means of personal protective equipment and collective as well. The latter one should be explained because there are not enough healthcare facilities which have appropriately established and equipped ventilation system, which should be providing for occupational hazard prevention, then technogenous on natural, environmental, and social reasons, which would be excessively high concentration of the pathogen of SARS-CoV-2 within the infectious care department. In preparation to this workshop, there was a question raised: should we pay attention to the investigation cases if they are not directly involved in COVID mitigation efforts? Now, there is resolution of the Central Commission on Mitigation of Emergency Outbreaks and special directive from the Cabinet of Ministers suggesting that every case of occupational infection should be pending investigation. And we cannot sustain that even if such healthcare facility, even if an individual healthcare facility is not directly assigned as a specialist to care for COVID-19 patients, there's no guarantees that a person with either infection or disease or being the carrier of infection will not be admitted to this facility, not only inpatient facilities, but also outpatient care institutions. And thus we pay attention to every case reported to make sure we maximize the health-saving and life-saving effects. And taking advantage of our today's wonderful opportunity, let me express my personal and our official appreciation to healthcare providers and wish you decent and reliable protection from the state and respect from the patients whose lives you are saving. Thank you, dear Ludmila, for highly empathic presentation. Let me hand over the floor to Mr. Oleg Panasenko, the chair of the Free Trade Union of Health Workers of Ukraine. Mr. Oleg, please confirm that you are with us. Good morning, dear participants. Let me also outline that the major encouragement for Ukrainian health workers would be having decent remuneration for the effort, for the labor effort that we invest in terms of responding to coronavirus threats, helping the patients who contracted such pathology. Unfortunately, there are some difficulties in this respect in Ukraine, particularly starting with the month of January this year, we start having interruptions with surplus payments for special COVID-19 allowances. The 300% allowance, as was expected and promised in favor of healthcare providers, was received only in individual cases, despite the fact that the seemingly management of healthcare facilities has been concealing about 16 billion Ukrainian hryvnias in total amount of funds, which should have been reallocated for the sake of these additional financial allowances to be disbursed to healthcare providers. Speaking of family clinicians, their access to such additional funding was limited because they fell under the action of the discriminatory formulation, which was included into the directive of the Cabinet of Ministers number 610, which says clearly that family clinicians are not entitled, as well as family practice institutions is not entitled to receive such additional payments and allowances. Moreover, looking into the support options made available to medical professionals, there's not a single cabinet minister's decree, not a single law of Ukraine which would be protecting our labor rights as well as professional rights of healthcare providers. The only means of professional defense which we can use to sustain our workplace would be the trade unions and trade union legislation. But the central government keeps offering such legal initiative which can boldly, in case of having a mono majority within the Ukrainian parliament, to abolish some of the collective protections and precautions which could otherwise serve in our favor. Speaking of the draft law 5153, which is totally annihilating such definitions as the labor code, as well as collective agreement law and regulations and trade union rights, which have been guaranteed by the fundamental legislation. This draft law, in case of its adoption, will be undermining and substituting all of the international labor conventions, as well as all of those legal guarantees and assurances as collective agreement to be entered into directly between the employer and employee. And definitely, this will be resulting in major disappropriate situation and implications development when potential employees will be signing a piece of paper rather than the actual labor agreement. And thus they won't be entitled to the guaranteed 8-hour working days, the duration of the respective working week, the OSH precautions, and a lot more. And that is why our Free Trade Union of Healthcare Workers of Ukraine, together with the Confederation, will be and are already officially appealing to the International Labour Organization, to international community, requiring your assistance in order to prevent such discrimination of healthcare providers, and not just healthcare providers, but also other employees in Ukraine, which otherwise may result in a novel form of slavery in Ukraine. So that would be the appeal which I would like to reiterate as part of my introduction today. Thank you.
Thank you. Mr. Vladimir Fesan, Chief Technical Inspector, Trade Union of Health Sector Workers of Ukraine. Hello, dear participants. I hope that our fruitful work would help us resolve all the issues in this sphere. We have studied the interim guidance of the WHO and ILO on occupational health and safety for healthcare workers, and we have reached the following conclusions. The most measures suggested by the guidance have long been all implemented in the current legislation of Ukraine, and it has already been reflected in both the regulations and in practice. So the issues now are caused not by the lack of procedures, but because there is lack of compliance with the requirements which already have been enacted. One of the reasons of the high incidence of COVID among healthcare workers, well, the trade union thinks that this is the breach of requirements to supply effective PPEs to healthcare workers. We have scientific research available saying that first and foremost, we should look at the so that essentially the lack of proper respiratory protection, proper respiratory PPEs is the main factor in increasing the infection rate. So of course the protection level should be fit to the risks for healthcare workers in the workplace. However, we see that now most attention in the state is given not to the protection of health of um, healthcare workers, but on savings of on PPEs. So healthcare workers for quite some time are suffering from the cancellation of their sectoral norms, sectoral procedures on PPEs, and now there's no clear norm and clear requirement on PPEs. So we have suggested to the Ministry of Health to issue at least interim norms of supply PPEs, so the quotas of PPEs. However, it wasn't done. There were only recommendations on rational use of PPEs. So these recommendations, they are in breach of current legislation in terms of how healthcare workers should be using respiratory personal protection equipment. The standards of care mostly provide for the use of simple surgical masks which do not protect from viral infection. So most healthcare workers who have to follow these guidelines are not protected. We have analyzed the requirements of the legislative acts of Ukraine, uh, including the standard referenced by the MOH, and it directly says that if the main objective is the protection of the user from infections, one should use the respirators. Surgical masks only protect from bacterial infections. We have been stating this in our uh, petitions to the Ministry of Health, to the State Labor Service, but unfortunately, we haven't got a proper response. Another idea I wanted to mention is the protection of healthcare workers from occupational diseases. We can say that the state essentially has capitulated facing the challenges of the pandemics. Having failed with proper investigation of death cases, they amended procedure 337, and the state has lifted the responsibility for proper investigation. Um, all the issues are still there. However, now it is the responsibility of healthcare facilities. So what are the issues here? We have mentioned the flaws, the lack of staff. We, we have the lack of specialists in labor hygiene, specialists in infectious diseases, and the lack of these specialists in facilities causes the delays in investigations. Also, the main principle of the investigation is violated, which is independence from the employer and the management of the facility. So, the special investigation now is conducted by HR or the accountant, so the managers of the victim. So I don't know, what can I say? It is very difficult to expect that the manager would find themselves guilty of a breach of requirements, occupational safe and healthy, and and causing the disease of the employee. Another thing I would like to note is delays with the investigation. Due to the lack of staff, the investigations take a very long time. So instead of 5 to 15 days, as is there in the procedure, the investigations take a few months. So the employees lose any hope to get the benefit, and they just write statements that they don't want to have the investigation of occupational incident, and they ask for at least having their sick leave paid, but there are delays with these payments as well. And of course, it influences all that. So it delays the prevention measures which could have been implemented should the investigation been timely. Also, I concur to the words of Ludmila Volodymyrovna about the low quality of epidemiological investigation. Indeed, we do not have enough epidemiologists, and as there's a lack of regulations for their work, uh, because the bylaws have been developed for the epidemiologists of sanitary epidemiological stations, and now this SES system has been already removed, now the epidemiologists don't have proper framework for their work. So the quality of investigations is still quite low and not and we don't have proper contact tracing, and sometimes I've been getting notifications that the epidemiological investigation was merely a few phone calls, and of course it affects the quality of the investigation. Also, I would like to note that indeed we hear a lot of complaints um, onto the difficulties with having investigations, and people expect some simplification of the procedure. So now the situation when there are no labor inspectors, I think also it damages the quality of investigations. It would be great if it would be labor inspectors who would be doing the investigations instead of having HRs and accountants doing that. So we submitted a proposal to the MOH on the inclusion of the occupational health specialists in the diagnosis of occupational incidents. But now it is merely a bureaucratic procedure which has no common sense, and it also is quite long and burdensome procedure. Now, we don't have a proper specialists in occupational pathology medicine, and usually they just do uh, so they can perform their services well as a service, and services should be procured and there should be a tender. So it of course it's very complicated to announce a tender to get the expert opinion of the specialist in, in occupational pathologies. So now, as COVID is included is into the list of the occupational diseases, so we do not essentially need the participation of these professional of occupational pathology specialists. Now, the case of COVID, which is investigated already, can be occupational incident by default. So uh, this, of course, affects the investigation. What I wanted to mention, adding to this, is the breach of regulations in labor protection when household sources of infection were identified. In most cases, it is caused by the fact that probably epidemiologists were not aware about item 8 of the instruction on the application of the list of infectious diseases, which provides uh, if the occupational etiology has been detected and both household etiology, it still has to be considered as the occupational incident. And as of today, the epidemiologists, well, I haven't seen a single opinion of the epidemiologist who would be applying that. Usually it's upon the discretion of the committee, and the committee finds it difficult to understand that we have uh, both operational documents of the committee and we have the requirements of the regulations, and the regulations take precedence, while operative documents such as an opinion of the epidemiologist are merely something for consideration. So item 8 has precedence over the epidemiologist's opinion. Another issue, the last issue I would like to pinpoint, is the lack of investigation of outbreaks. The law says that the outbreak is the i- is a locality where infection transmission has been detected. If we look at the main facilities where several healthcare workers are ill and there might be a transmission of infection caused by their occupational contacts, well, we have to look at these facilities as the outbreaks of occupational um, diseases. And the law says that there should be investigation and inspection and response measures and prevention measures should be initiated there. We have suggested doing that as the law provides, but in practice, it was impossible. As for uh, as for the interim guidance, indeed, we have seen some uh, new suggestions, and it is important. Then this is mental health and psychosocial support of healthcare workers. Indeed, there is the burnout due to the burden, and all health workers indeed they are on the verge of burnout and they need support. So I think the Ministry of Health should pay attention to this and they should develop some uh, national guidance on the provision of psychosocial support. And it would be great if after the draft is developed, it would be great to get the opinion of health workers so that they would say that indeed it could help them. Thank you so much for your attention, and I look forward to having fruitful solution to all these issues. Thank you. Thank you, Vladimir. I see we have uh, a question from Oleg Panasenko and from Ms. Yosipenko. So first, let's give the floor to Mr. Oleg. I would like to support the previous speaker and to highlight that all these matters could have been uh, resolved should our parliament and the government would actually fulfill the 4228 resolution of the parliament adopted December last year, and it says that in Ukraine we should create the national headquarter on COVID response. It still has not been created. And if this response headquarter would be created, it would include the heads of two sectoral trade unions. And then we would insist on adherence to all the guarantees and labor rights of those who fight COVID infection. Next, that resolution 4228 provided for the immediate restoration of the state epidemiological service, which has been completely destroyed by Uliana Suprun, and nobody is restoring it. So that is why in Ukraine we now do not have the systemic approach to COVID response, and we don't have systemic protection of the health workers who are fighting the infection, and there's no clear implementation of current regulations which guarantees decent and high salaries and these um, additional payments of 300%. And there was a question about the number of the draft law which removes all powers from trade unions. The number of the draft law is 5371. And I repeat that it introduces slavery in our country and serfdom. And in the conditions of economic decline and total joblessness, um, the applicant to a position would just sign any paper proposed by the employer. Thank you. Thank you, Mr. Oleg. Ms. Ludmila, if I may, I would like to comment on the simplification of the investigation procedure. The investigation has been simplified only for certain categories of health workers. The ruling of the COVID response lead has set out the number of of positions and occupations. And if a healthcare facility has been included in this list, and if the occupation of health worker is also included in the list, then the investigation can be simpler. So the list includes the facilities which provide primary, secondary, and tertiary care to COVID patients. And this investigation has been simplified upon the requirement of the Ministry of Health and other participants of the investigation process, as according to many participants, the delays with investigations have been caused uh, because the Social Insurance Fund and State Labor Service were delaying the process. That is why these representatives of these two bodies have been excluded from the investigations. In terms of the bias of healthcare facility management when doing the investigation, as of today, do not see any influence, because out of 45 investigations that have been completed by healthcare facilities, we see 29 conditions related to work conditions and only 16 were not related to work conditions. So if we look at our investigations conducted by the territorial bodies of state labor service, we see the different picture. So we think that healthcare facilities on their own can conduct effective investigations, and our territorial offices are always happy to help to all the healthcare facilities and the organizations of investigations, and finding whether it was caused by the occupational factors or not. In terms of the timeline, indeed, now investigations take longer than was provided in the law, longer than 5 days, but this is because certain documents have to be obtained. We have to get the opinions of the occupational pathology specialists. The service has suggested to amend the instruction on the application of list of occupational diseases and to exclude or to add another line that the diagnosis of acute occupational disease of COVID can be said by any physician who diagnosed the disease, and without the participation of occupational pathologies, and perhaps without taking in the results of occupational investigations, because they are not effective. And on occupational pathologist opinion, well, most opinion just say that it was in line with the investigation. If we have the notification that the person was sick at workplace, then we are obligated to investigate and to establish the causes of infections.
Speaking of failure to implement infectious control precautions within healthcare facilities, this is a very major problem, because indeed this results in untimely identification of the source of infection. Mitigation efforts are delayed, and as the result, we have excessive incidence rates among healthcare workers. Definitely, medical standards do stipulate ongoing monitoring and testing of healthcare workers for the sake of timely identification of people who carry infection, or people who have the disease. Unfortunately, in the healthcare sector, these standards are not observed, and IPC measures are not fully implemented. The more so, prophylactic medicine as such is stagnating in Ukraine, because in our case, the epidemiological investigation is necessary not only for the sake of conducting our investigation in case of occupational incident, but it's also critical from epidemiological point of view to identify the source and prevent its transmission. This is a classical case of epidemiology, which today, unfortunately, in Ukraine is not observed. Nevertheless, we are quite hopeful that we will revert to prophylactic-based medicine, which will become #1 modality, because looking to the classical pattern, prevention is the key of health and life, not only of healthcare workers, but also of each and every person living in this world. That's why we hope and believe that Ministry of Healthcare will follow our recommendations and reflect the respective clauses in their regulatory documentation. Thank you, dear Ludmila. Madam Helena Yospenko, do you still have any questions or comments to suggest? Thank you. If not, then let me hand over the floor to Mr. Volodymyr Semenenko, Chief of the Federation of Employers in the Health Sector. Mr. Volodymyr, you're welcome. Thank you, first of all, for the kindest invitation and the opportunity to address the esteemed audience. And let me first welcome all of the participants of our today's discussion and wish further productive work and performance, and first and foremost, good health to everybody, and making sure that your health is not threatened by any environmental aspects, including the impact of pandemic, whether in occupational and community setting. I was listening quite attentively to all of the speeches and unfortunately have to admit that some representatives of trade unions believe that employers are not allies but rather enemies. But let us live with that. Nevertheless, the opinion about the employers as enslavers and who are blood eager is not rather constructive. Nevertheless, now coming down to the subject under our today's discussion, which has brought all of the esteemed audience together, let me reiterate that the key agents involved in epidemic response would be the doctors, medical workers, employers who provide the working environment for this process. This is our employers' responsibility. And of course, the key agents involved here would be the government representatives, because this is the government which sustains implementation of the national policy in the context of response to the pandemic, including Ministry of Healthcare. But definitely, this is how it should be addressed globally, but in Ukraine specifically, we are talking about response to pandemic. There could be other etymologies used. Naturally, healthcare providers are in the front line in this situation, as well as the employers in the healthcare sector. If medical workers are directly involved in handling the patients, either in inpatient facilities or family medicine facilities, and they have some limited working hours, then management of healthcare facilities and employers, this working time involvement is not limited, and in many cases we have the so-called unlimited working hours, and this should be 24/7, both in the office as well as household situation, because even when we go to bed and sleep, we still have our brains busily engaged with everything associated to sustain the operational performance of the subordinated facilities. So should anyone think that we are the exploiters, then that would be the erroneous position to assume. I've been managing healthcare facilities for many years, but I have never allowed myself such an understanding or such treatment and perception. And some of my subordinates, well, now my contact has expired, but speaking of my previous practice, I have never assumed such positions. And I do truly believe that the doctors and other healthcare workers of Ukraine are one of the best in the entire world, because I know how our professionals work and I've seen what other professionals do in other countries. And most importantly, the employers are making every possible effort on their behalf to sustain, support, and provide for the process of uninterrupted and safe performance for the employees. So the question is, are all of the employers at all times capable of sustaining such process and environment, remembering that sometimes this is pending additional resources and assurances on behalf of the government and the state to make sure that the employers, management of healthcare facilities have enough resources to provide for the occupational safety and health as well. On the other hand, what about the workers? Employees, are they always abiding by the norms, rules, and standards set? which is not always the case. I do understand there's excessive workload. I do appreciate all of that. But how can we understand the facts when, for example, medical workers in individual facilities, maybe this is not the main flaw, but they would be having an evening party to celebrate somebody's birthday, which then results in an unexpected outbreak of the disease. Don't you find a clear relationship between those facts and events? And that is something to be mindful of. So let me once again reiterate that the national policy, not speaking of Ukraine alone, because again, we have information coming from different countries, but speaking of Ukraine, it should be aimed at making sure that this state, which first and foremost has the rights for reallocation and redistribution of finances in Ukraine, then the state should reallocate them as appropriate in the context of pandemic to make sure that all such resources are plentifully available primarily for the benefit of healthcare facilities. Unfortunately, recently, healthcare sector was funded following the residual balance, 3% from GDP, 3 to 4% maximum. And should it go as high as 3.5% in some years, then that would be considered a heroic deed. So again, we have a given percentage of allocations based on the national GDP, but in order to sustain its subsistence, we need at least 8% of GDP. But when we are talking about pandemic response situation, this percentage should be higher. But let's look at the realities. Last year, the so-called COVID fund shared part of its funding were for the road maintenance and infrastructural projects. And this is one of the specificities of our Ukrainian technique of managing healthcare sector. Further speaking, let me also reiterate that unfortunately, again, population of Ukraine, I mean citizens of Ukraine, are not always demonstrating responsible attitude and behavior. Looking into the pandemic environment that we are experiencing, in many cases, people are neglecting lockdown restrictions, non-observance of social distancing and restrictions, failure to use personal protection equipment and other preventive precautions, sometimes aggressively responding to reminders and instructions for their own safety. And that results in additional aggression manifested by some citizens against health workers as well. Some citizens fail to understand that most of the restrictions and lockdown limitations are imposed for the sake of preserving their own health on the one hand, but also on preserving the capacity, existence and resilience of the healthcare system as well, to make sure that we are not overwhelmed by the avalanche of new cases. And that should be reinforced by the government, reinforced by the mass media. This should be reiterated on the daily basis, including vivid manifestation of the terms and environment that healthcare workers have to deal with in delivering their function. So again, enforcement of those restrictions and responsibility for violation of those should also be part of the comprehensive interventions, and then we can expect effect of epidemic prevention and response activities. Quite recently, there was a very interesting question raised for public discussion about investments into the public health, but the government should also establish the incentives for the business representatives and other investors, thus making them motivated to invest, because they should find some benefits to favor their contributions. And we have seen multiple cases of wonderful donations made by businessmen to individual patients, to individual healthcare facilities, helping them to manage the infection properly, procuring equipment, procuring disposables, procuring PPE supplies, and sharing them with the facilities. And that also been supported by the employers' organizations, sectoral institutions as well. But the state should be first and foremost offering the respective attitude, support, and environment, including and sharing that with the business representatives and donors. But what do we have? What about the corporate social responsibility? It failed. What about social dialogue? It's non-existent. The government does not see any social partners, and it's trying to address every possible question, problem, and issue unilaterally. Well, in the case of any discussion raising or possible communication with the business, then in most cases, the social dialogue representatives of the same employers are substituted by some civil society organizations due to the unknown reasons. And such CSOs are voicing up the opinion which coincides with the unilateral position assumed by the government party. So definitely, there could be no social relationship in terms of harmony and synergy under the circumstances. And that can be aggravated further by the fact that along with the pandemic, we still have the reform process ongoing in the healthcare sector, which is an additional burden, including that for the employers. First and foremost, because employers on the daily basis every hour and every minute should find responses to the questions which cannot be prompted by anybody else. And this is a tremendous load on the employers who should and are obliged to respond as necessary. And that's why there are psychological breakdowns among the employers. Many of them are ruining their business, are abandoning their business, although such cases are not reported and not accounted for anywhere. But this is also part of their life and job. Well, definitely now, speaking of what was mentioned about the use of different forms of labor relations, including different type of agreements entered into between the parties. Yes, as we all know, speaking of occupational health and other implications, there are employees of communal type, of government type, private type. And indeed, if communal and public institutions receive their funding from the national budget, then the same private businessmen or individuals and who are paying taxes, which then contributes to the pool of funding made available by the state, then the private sector employers have to address a greater number of issues. Well, sometimes great, more or less, but first and foremost, seeking the necessary funding would be one of the top priorities to sustain performance of staff, to sustain performance of the private clinic, making sure nobody is fired from their positions while all of the taxes are diligently paid, and also making sure that the standards are kept high, as well as all necessary supplies and assurances are made available in place for the sake of occupational safety and health and quality of the service delivered, while at the same time keeping the price of that service as affordable as possible. And this explains why such different types of labor relations with the hired members of staff would be enacted. Now, speaking of another question raised, involving sanitary and epidemiological station officers, it has not been abolished, it has been transformed. So now this function is delivered as part of the umbrella scope of another institutions. But in order to understand what is the impact of such function delivered by the sanitary and epidemiological service in terms of pandemic response, And definitely we can match it against the examples of performance manifested by other countries. Let us take the Russian Federation, for example. Their situation is fundamentally different from the Ukrainian, first and foremost because they have preserved this service. So this is not the matter for speculations, and we should be led by the common sense and sober judgment. And finishing my remarks, let me once again announce that employers are not always ideal. Employers are experienced managers, and there are some inexperienced ones as well. Many of the employers are members of trade unions at the same time. So with that, appealing to our social partners, I still believe that we are all social partners here. We are not enemies. We should be allies. Let me reiterate that many employers are still paying their membership fees and contributions. And that means that you should change your attitude to make sure that we have our relationship led by the spirit of partnership and alignment, and not enemizing each other. Like sometimes, in some cases and instances, this is used, making some political connotations and expressions. Now, speaking of some residual funds and leftovers sitting in our accounts, definitely we have to find out what is the nature and whether these funds are earmarked for some additional needs and how to best use them. And with that, let me also emphasize that indeed salaries in the health sector are not the highest possible, or even when compared with other sectors. But to make them the highest possible, then some national policy should be made, and that should be manifested in the new attitude, including the official position assumed against healthcare workers in Ukraine. And that would be certainly serve to better gratify the effort made by the healthcare workers, reflecting their self-sacrifice, which they sometimes put at stake while delivering their jobs. Nevertheless, sometimes, including mass media publications, we still observe highly criticizing and sometimes even humiliating expressions admitted regarding the role and function of health workers in our society. And that is something that we have to address by working together. With that, let me finish by saying that all of us, I would like to wish all of us well-balanced appreciation of the reality that we live in. For all of us to be highly pragmatic in delivering our professional functions, making sure that we are not overwhelmed by the emotions, which might prevent us from objectively looking into the reality, investigating as necessary, making the adequate actions. And with that, also let me express my expectation that the social dialogue in the Ukraine will be renewed and recreated so that the state employers and employees will come together to the understanding that we cannot address any issues without taking into consideration position of the social partners, because we are working in the real sector. We, the employers, are the ones who sustain contributions to the budgets, which are further on reallocated and redistributed for any needs. We are providing for stable performance of the working teams and of the hired members of staff. And if there are no employers, then there will be no employees, respectively. And we have to treat each other as social partners. And now, speaking of your offices, if you have hired workers within your jurisdiction, then you are also employers to a certain extent. And thus, the same terms and regulations apply to yourselves. And should you be inspected tomorrow, then definitely a number of violations or incompliances will be found on your behalf as well, and that will be holding you accountable. But most importantly, let me wish all of us good health and optimism, because we are quite confident that working together will be successful in overcoming this epidemic. and will be successful in mitigating the risks and the outcomes. And let me sincerely wish that none of this affects you personally.
Thank you so much, Mr. Vladimir. I see that Mr. Oleg has a question. However, dear colleagues, please know that we are behind the schedule. Only a short comment. Yes, thank you. Our Ukrainian Trade Union Association has never thought that employers are our enemies, adversaries. No, we look at the employees as our social partners. We have been discussing the legislative initiative which would be presented by the majority from the People Party, and it has been laying the foundation for the social dialogue. And indeed, the speaker has duly noted that in Ukraine, at the national level, there's no social dialogue, and it's a slim chance that we trade unions and the employers would be able on our own to reinstate the social dialogue without the support of the international partners, the ILO. Thank you for your stance, Mr. Oleg. However, when you said that the law 5371 would lead to the employer um, treating the employees as slaves, well, I disagree. The employers and employees are all humans, and the employer understands that he is an employer today, but he might be an employee tomorrow. So this process is dynamic, and today you are presenting the trade union, but tomorrow you might be an employer, uh, and we have to have mutual respect, which is extremely important. And I hope that we will not have any contradictions which would impede the social dialogue. Thank you. I fully agree, fully agree. However, apologies, thank you, thank you. As a chairperson, I would like to announce the end of this session. I thank all the colleagues for their presentations, and now we move on to session 2. Joachim, please, you get the
Thank you
floor.
very much, Mr. Dimov. First of all, my good morning to all the friends and familiar faces I can see here, either as speakers or as participants. The next session will focus on national occupational safety and health programs, which is a fundamental planning tool to give practice to national law and national policy, which should be based on an accurate knowledge of the situation in the sector, or as we in the ILO say, it should be based on a sectorial profile of occupation safety and health. This is a planning tool which should be developed by the government in close collaboration with social partners. And as we are running a bit late and without further ado, I'll just introduce the speakers for this panel. We have with us representing the WHO HQ in Geneva, Dr. Ivan Ivanov, the head of the Occupational and Workplace Health Environment, Climate Change and Health Department Division for Healthier Populations, as I said, from WHO HQ, and also from Geneva, from the headquarters of the International Labour Organization. We have our colleague, Ms. Christiane Wiskow, Senior Specialist for Health Services from our sectoral department. Ivan, the floor is yours, please.
Thank you very much, Joachim. It's a pleasure to be with you all. Good morning, good afternoon, dobry dzień. I would like to, together with my colleague in the International Labour Organization, Christiane Wiskow, to bring your attention to the need to go beyond the current debate on COVID and think about the future, because the future needs to be healthy and safer for all workers, including those in the health sector. There has been some talk about health workers, healthcare workers, medical pracowniki, mediczni pracowniki, and I would like to clarify that when we talk globally about the health workers. These are all workers in the health sector. It's not only the health care workers, which are the doctors, nurses, and midwives, those who are directly involved in patient care, providing patient care, but also the cleaners, the ambulance, the painters, the public health professionals, the community health workers, all groups in the health sector are health workers. And now in the context of the year of health and care workers, we also talk about those who provide care, for patients, those who provide care for the elderly, those who provide care for the children. So this is an important distinction. And it is very important to use proper terms, because now when we see in countries that are rolling out the national vaccination programs, priority is given to health care workers, doctors, nurses, and midwives, and the cleaners, who often actually have a lot of exposure to the virus. They are not offered protections. So this is very important. The health sector is one of the four most hazardous sectors in the world, together with agriculture, together with construction and mining. And just here you have some facts and figures that illustrate how dangerous is this health sector in terms of exposure and the effects, exposure to pathogens and to the occupational infections, tuberculosis. We had in the past outbreak in Ebola in West Africa, we had a lot of Ebola infections. Now we do have a lot of COVID-19 infections among health workers, but it's also chronic low back pain because of unergonomic working conditions. And this is a very, very bad situation where health workers really cannot continue to work because of chronic low back pain, but also burnout, violence. Some medical professions like doctors are at high risk of suicides. And we see also the depression and anxiety exacerbated by the current epidemiological crisis. Therefore, last year, on the occasion of the World Patient Safety Day that was devoted to health worker safety, a priority for patient safety, WHO and ILO had a joint press conference. Both the Director General of WHO, Dr. Tedros, and the Director General of the International Labour Organization, Mr. Guy Ryder, they made strong statements about the urgent need to work toward improving working conditions in the health sector, toward providing a greater level of protection for health workers, not only personal protection, but also establishing systems, programs for sustainable protection of health workers against occupational risks. Several years ago, WHO and the International Labour Organization developed a global framework for the national occupational health programs for health workers, which emphasizes 13 key elements: that there should be a written policy on safety, health, and working conditions for the health sector, both at the national level, but also at the level of healthcare facilities. That there should be someone or a unit at the national and the facility level responsible for occupational health and safety. Without a living body, without a warm body, without expertise, without structure, nothing happens. There have to be occupational health services for all healthcare workers, all health workers, for all healthcare facilities. There has to be budget, there have to be personal protective equipment. Also, in the previous session, it was highlighted how important it is to have social dialogue at the national, at the facility level. Therefore, there have to be joint labor management, health and safety committees also in all health facilities like we have in other sectors. There have to be ongoing periodic education, training of all these responsible people and the members of the safety committees, regular risk assessment of the workplaces, the processes, Several infections, occupational infections, can be prevented with immunization. For example, hepatitis B. Now we have the COVID-19. Also vaccine. There has to be a regular exposure and incident reporting. For example, reporting of exposure to blood-borne pathogens or exposure to respiratory infections, incidental exposure, and also for example, cases of violence, harassment at the workplace. There has to be mechanisms for reporting without the workers being afraid actually to say that they have been exposed and they had this incident. There has to be also a good system for diagnosis, treatment, and care for occupational infections and other occupational diseases among health workers. Information system indicators to measure the performance of the program at the facility and at the national level. Compensation of work-related disability according to the national laws, research evaluation, but also improving the overall environmental conditions in healthcare facilities. For example, good management of healthcare waste, water sanitation, cleaning, and addressing the chemicals at the workplace. This last year, on the occasion of the World Patient Safety Day, WHO and ILO issued a policy brief caring for those who care about the national programs for occupational health for health workers, which provides a lot of arguments for policymakers in the health sector, for workers, for employers in the health sector, why these programs are needed, what they can get, and what is the cost of inaction. And we see what is the cost of inaction, because in countries which did not have pre-existing such programs, which did not have systems to protect health and safety of health workers in the healthcare sectors, they suffered enormously during the COVID-19 pandemic. They had high rates of infections. They had a lot of problems with mental health, with other also occupational health problems. And we see also in the case of Ukraine, the reporting of the injuries and incidents involving oxygen supply. So we invite you to look into this document. It is available also in Russian, and to consider this document also as a roadmap for developing such a program in Ukraine. We also have issued an open WHO course. These are online courses that are free for the world for occupational health and safety for health workers in the context of COVID-19. Currently, it is available in several languages. Unfortunately, Ukrainian or Russian are not among the languages that are covered, but we welcome volunteers who would like to translate into the Ukrainian or Russian language to contact me, and then we can arrange that. Then I would like to pass the floor to my colleague and friend in the International Labour Organization, with whom we are working on pulling this cart together to make the world healthy and safer for health workers. Christiane, you can continue.
Yes, thank you very much, Ivan, and good morning, good afternoon to everybody. Thank you for the invitation. Now, I take over here to explain to you the ILO perspective on this. And as you can see, the ILO in its over 100 years of existence has always had the protection of workers at the core of its mandate. It's enshrined in the ILO's constitution of 1919. And last year, when celebrating the 100 years of birthday, the ILO Centenary Declaration adopted by the International Labour. Thank you, Ina. And the Centenary Declaration of the ILO contains calling for a human-centered future of work, calls for safe and healthy working conditions that are fundamental to decent work. And the ILO governing body, consisting of the governments, employers, and workers, are following up on this to discuss, including occupational safety and health within the framework of fundamental rights, principles and rights at work. The ILO takes a rights-based approach to the world of work. So labor rights are key to ensuring the protection of workers. They provide a legislative framework to it and guidance through various tools. Not only in COVID-19 or other health emergency situations, but in general and in their daily work, health workers need to be covered by regulations that protect them, their health, and provide adequate financial compensation for loss of income and cover the costs of medical treatment in case of sickness. As already alluded to by previous speakers, social dialogue is really critical for enabling all stakeholders to play an active role in responding to COVID-19 and other emergencies. And the experience has shown that where national programs on occupational safety and health for health workers were existing already, those countries and health facilities were much better and more effective in implementing systematic and comprehensive emergency preparedness strategies while protecting the workers. Overall, decent working conditions are critical in two aspects. With decent working conditions, health workers are enabled to provide quality of care. And it also has a key role in retaining qualified and motivated health workers. We see, unfortunately, in the context of this pandemic, that many health workers have the intentions to leave the profession or have left them already, which I have also seen in the report of the Human Rights Monitoring Mission on Ukraine that was also mentioned. Ivan had already mentioned the Global Framework for National Occupational Health and Safety programs. So this is just one part of an overall approach that integrates national and health facility levels. And this is just to show you how this links together the various tools that we have developed over the years. So the framework was adopted in 2010 by the ILO governing body. It provides guidance for establishing the building blocks of a national program. And when a national program for the occupational health for health workers is being developed while consulting with social partners and government, this provides guidance for the implementation of occupational safety and health measures in the health sector at the work floor level. So to help implementing these aspects of occupational safety and health, WHO and ILO have jointly developed the HealthWise tool, which is a practical and participatory tool for improving workplaces with a focus on occupational safety and health and well-being of health workers. By improving the work environment, you will also improve the performance of the health facility. Now, somebody spoke about the cost of inaction. It was Ivan. And it is indeed that by not doing anything, that is true. It will create a lot of direct and indirect costs in terms of sickness, absence, and so on. Along with the HealthWise tool, and Ivan has already mentioned it, we also developed checklists, because the checklist is the main assessment tool at the workplace level to guide actions. We see that many managers and health workers on the ground have really good ideas to improve their workplaces, but they do not know how to implement them. So these tools help you to improve your workplaces. You don't have to be necessarily an expert, but just doing it by yourself, you will learn how to improve your workplaces. Thank you. So there are a number of ILO standards on occupational safety and health, and my colleagues from the ILO will speak to that in more detail later. Let me just point out two tools, and that is the very recent Violence and Harassment Convention, a groundbreaking new instrument, the first ever on violence and harassment in the world of work. And unfortunately, we will hear about that later. This is an aspect of safety and health that is very present in the health sector. The health sector is one of the most affected sectors of violence and harassment, unfortunately. I also want to mention the Nursing Personnel Convention number 149, because this provides very specific guidance also on occupational safety and health with its recommendation, but also to all the aspects we will speak to later when we present the joint interim guidance. You may be aware that Ukraine is one of the countries that has ratified the Nursing Personnel Convention in 1979. So you have already legislative basis that can help you improve the situation, not only of nursing personnel, but also other health workers. There are a number of tools that we have developed, the interim guidance you will learn about later. The ILO with the joint WHO, OECD and ILO Working for Health program has developed a checklist on COVID-19 and which measures to be taken in health facilities to help health facilities prepare and prevent infection and protect their workers. There's also a checklist by WHO on the implementation of national programs on occupational health and a number of other tools that we have already mentioned. Next slide, please. Thank you. So you can do something yourself. In the context of the World Patient Safety Day last year, there was a call for run your own campaign to speak up for health worker safety, because it is recognized that there will be no patient safety without a health worker safety. So with this in mind, thank you very much for your attention.
Thank you very much, Ivan and Christian.
Now, good afternoon, my dear colleagues. So once again, good afternoon. My name is Yuri Zhikharev. I'm the National Advisor on Clinical Management of COVID-19 from the Country Office of World Health Organization in Ukraine. And with that, we are continuing to the next session under the agenda. So that will be session number 3, and I have the pleasure of moderating it. Discussion will be dedicated to presentation of the interim guidance of the World Health Organization and International Labour Organization. So in this session, we will dwell on the practical issues which are associated with different aspects of implementing these guidelines and the tools associated therewith in Ukraine to make sure that we are better protecting our health workers in the respective situation. And the first speaker under this session will be Victoria Villet. I have the pleasure of inviting her on behalf of the headquarters of World Health Organization to discuss SARS-CoV-2 and other occupational diseases. Dear Victoria, you're welcome.
Thank you for inviting me. So I will try to move quickly. I know we have other presentations in this section. So I just want to start by highlighting a little bit about the issues around SARS-CoV-2 infections in health workers. And there's no denying that health workers throughout this pandemic have been at higher risk of being infected with SARS-CoV-2 than the general population. And from the World Health Organization global surveillance data, which there are some challenges with this data and it is likely underreported from the information that we are able to get from countries. But what we can see is that in general, health worker infections have initially exceeded around 10% of reported cases of SARS-CoV-2 infections. But this has been gradually declining throughout the pandemic. And as of last fall, we were seeing infection rates around 2.5% of the population. Additional studies have looked at incidence of SARS-CoV-2 in health workers, and you can see there's quite a wide range and variation in that between 0.4% and 49%, and also in the prevalence of SARS-CoV-2 seropositivity. Again, we see quite wide variation in those reports. So transmission of SARS-CoV-2 infection in health workers can occur in a variety of ways. In healthcare settings, we see it occurring from contact with patients and also from interactions amongst the health worker themselves, including in common spaces such as break rooms, areas where they would be gathering and perhaps working together. And so measures have been put in place to try to alleviate that. And of course, in community settings where they may be exposed to household members, participating in gatherings, there's been risks of infections there as well. And of course, there is always the risk of the health worker who is infected then transmitting that virus to others in the community. And when we ask ourselves why this is important, one of the main reasons is that when we have a lot of health workers infected, they are not able to be at work potentially, and this can lead to a depleted workforce in a time when health services are in high demand. So WHO has commissioned a living rapid review of literature to look at what the risk factors are for health workers becoming infected in healthcare facilities. And we have identified that there are certain procedures that they may be involved in performing, such as intubations or other aerosol generating procedures that increase their risk of exposure to the virus and therefore risk of potential infection. Direct contact with patients and their bodily secretions. We know that there has been, in some areas, inconsistent use or incomplete or improper use of PPE. It could be for a variety of reasons, which are discussed in our literature review. Exposures in common areas, such as break rooms, cafeterias, areas where staff congregate, have all been identified as risk factors. And in the US and the UK, health worker infections have been associated with higher in the Black, Hispanic, and Asian race or ethnicity. And also recently, over the last 6 months or so, even longer, we're seeing higher risks in the community for health workers. So those that are exposed through events or interactions outside their place of work. So even though we have risks for health workers, there are measures that have also been shown to be effective in reducing these risks. And these measures really include having an effective infection prevention control program in the healthcare facility and an effective occupational health and safety program. And these two programs really need to work collaboratively to provide a safe environment for health workers and reduce those risks of infection. There's some other key measures that have also been shown to reduce the risk of infection in health workers. These include implementing a surveillance program, infections for COVID-19 or SARS-CoV-2, and looking at implementing strategies for testing of health workers for early detection of SARS-CoV-2 virus. Some of the other important measures that we need to have in place in health facilities to reduce the risk of infection in health workers is ensuring that there's a blame-free process that health workers can report exposures to SARS-CoV-2. And these need to be exposures that are both occupational related or non-occupational. Health workers need to know that they can confidentially and comfortably speak to someone in their organization and take appropriate measures to ensure there's no transmission that occurs in the facility. So in addition to that, for those health workers that do acquire an infection of SARS-CoV-2, we need to have a really good process for managing those health worker exposures, for both assessing them, determining whether they should be off work or can continue to work, that they understand the measures they need to take for infection prevention and control. And if they are ill and need to be off work, looking at what kind of criteria are in place to safely help them and guide them to return to work when they are well and no longer infectious. So again, the occupational health program and infection prevention control really need to work collaboratively on establishing these protocols to ensure the safe environment for the health workers. And this includes conducting surveillance activities. And if we're going to do surveillance, we need to make sure that we're analyzing this and reporting what we're seeing in health worker infections so that the facility can go on to improve measures to continue to provide a safe environment. When we're looking at how we can improve measures to prevent occupational health infections, both infection prevention control and occupational health programs turn to the hierarchy of controls, which is a framework for establishing measures to protect health workers and create a safe environment. And of course, if we follow the hierarchy of controls, the most effective and best measure is to eliminate exposure to the virus or any potential of interaction with a hazard. And this may be relevant in some areas in a healthcare facility where some staff may be able to remote work or have telehealth or remote interactions with some patients. So it's certainly one action we can consider, but it's not always possible in healthcare to take those sorts of measures. Of course, substitution is not applicable for occupational infections at this time, but we can then go into engineering controls. And in engineering controls, we're really looking at the infrastructure and design of the area where the patient care is taking place. So looking at proper rooms for isolation, proper flow of the organization, looking at the ventilation in the system and making sure that we have adequate ventilation, sanitation measures, touch-free as much as possible, but where things aren't touch-free, that we have good cleaning and disinfection protocols, barriers where possible, for example, in an emergency department or reception area, that there's a barrier between the patients and the health workers, and of course, safe needle devices. There's many, many different things that we can look at. And all of this is outlined in both the occupational health guidance and the infection prevention control guidance documents from WHO on our website. Under administrative controls, which are really measures that we put in place to ensure that we change the way people work and behave. And these are looking at restricting access to the people that need to be in the facility, looking at what kind of screening and testing are done of individuals as needed. And we can't ignore that we have to really look carefully at the type of work that people are doing, how long they're working, are they getting the adequate breaks? Because if our health workers are not getting enough rest and enough breaks and they don't have enough support, mistakes can be made in the practices that they're doing, and this puts them at risk. And this sort of takes us into the lowest level, which is personal protective equipment, which is one that we all tend to rely on, but we know is also the least effective in many ways because it requires so many interventions and so many actions from the health worker to safely use this, and mistakes can be made. But it is an important element, and having staff properly trained in use of personal protective equipment, knowing which equipment to use, how to put it on and take it off, and how to properly dispose of it are extremely important. And of course, we can't ignore vaccination as well as one of our controls. So one of the important things employers need to do is to conduct a risk assessment to identify the potentials for occupational exposure to SARS-CoV-2. This should be done, of course, in consultation with health workers and with other experts in the organization, infection prevention control, occupational health, managers who understand the workflow, and as I said, the workers themselves. By doing this, we can look at where are the risks of health workers being exposed to the SARS-CoV-2 virus and what sort of level of risk may be associated with those exposures, and then determine the measures we can put in place in the facility to mitigate those risks. And this would include also, I think this is extremely important, identifying your priority groups for vaccination for COVID-19 as it becomes available in the facility. That's one of the key elements of risk assessment that you're also going to look at. Who are your priority groups that are most at risk for infection? And in addition to other health risk factors such as age, underlying medical conditions, and then putting all that together to identify who you're going to target. So WHO has developed a framework for identifying levels of risk related to the types of work that health workers may be providing or conducting. And based on those types of risks, there are a number of strategies that facilities can put in place to mitigate the risks as much as possible to prevent any infections. So we have low risk, medium risk, high risk, and very high risk categories of infection exposure, and job tasks that could be identified. So I'm going to go into these a little bit more detail in the next. So if we look at the types of tasks that health workers may be conducting that are considered lower risk, some examples would be administrative work. For example, perhaps people working in the finance department, they maybe do not have direct contact with patients, or there are limited contacts even with coworkers, because we have to remember our exposure to our coworkers also puts us at risk. So when you're looking at what can the facility to do in these sorts of low risk situations, again, looking at remote work and teleservices wherever possible, and then some infrastructure such as ensuring enough space in offices or between people wherever possible, providing good ventilation, environmental cleaning, and again, measures to ensure that the spaces are not crowded and that are limiting the mixing of workers with one another. And of course, really important are flexible sick leave policies so that any staff who are perhaps not feeling well are not coming to work and feel comfortable in being able to identify that they need to stay home. And really, we need to make sure we're communicating to workers that they do stay home if they are unwell, to observe good hand and respiratory hygiene, and where masks use are required in the facility, that they understand when and how to use those masks. If we look at medium risk jobs and tasks, these would be jobs or tasks health workers may be conducting that will involve contact with patients, visitors, perhaps suppliers coming into the organization. So you would be looking at your logistics department, supply department, who are they interacting with? And again, where there is interaction with coworkers. But these are not necessarily people we that know or suspect to have infection with SARS-CoV-2. So these could be, for example, on a nursing ward, the non-COVID ward, where patients are admitted for other reasons. And we still need to identify that there could be missed cases and they are still being, there is still some risk. And so in these situations, again, wherever possible, if we can have alternative methods for interaction, such as telehealth services, again, looking at engineering controls such as barriers where possible, or good ventilation is really important. Many of the same themes that we carry over from the low risk apply to the medium risk, and making sure staff understand to maintain distance wherever possible, to not congregate, all of the usual things. But in this situation, we also want to make sure that staff understand the routine IPC measures that they should be following, such as hand hygiene, use of PPE when needed according to risk assessment, and of course, if transmission-based precautions are in place, and that they understand how to do that properly and effectively. For the staff who work in these kinds of roles, they need the same kind of communication, stay home if they are not well, observing their infection prevention control and public health measures, hand and respiratory hygiene. And again, if the facility has a mask policy in place, And in general, in healthcare, if there is community-based transmission happening, there's a recommendation to consider use of masks and universal masking, that they understand that and they're wearing them appropriately. So now we're moving into what has been identified as jobs and tasks that are considered high risk. These are situations where staff or workers in a facility are coming into contact with patients or people who have symptoms of SARS-CoV-2 or COVID-19. These can be a variety of tasks, so they can be professionals who are actually caring for the patients who have these infections, but we also have to remember that the people cleaning the areas are also at risk, people delivering equipment to these areas. There are a number of opportunities for people who are involved in the care of COVID-19 patients that could become exposed. Any person who is coming into contact with respiratory samples, so we have to look at our lab staff and transport staff who may be transporting these specimens, they are considered high risk. And also any staff who may be involved in the transportation of patients with symptoms of COVID-19. Similar measures, we're always looking, of course, at reducing the exposures and the encounters with people who have COVID-19, but in this situation, clearly these people need to be in the hospital, so we really have to look at our engineering controls, which is adequate flow, adequate ventilation, looking at PPE and that the staff are trained on PPE and how to use it. We have good cleaning and disinfection, and then again, flexible sick leave policies. And for the staff and the workers and even any caregivers that may be in, they have to have proper training on PPE, standard precautions, transmission-based precautions, so it's quite complicated. And again, staying home if they are not well. And any patients or visitors or additional people that are coming into this facility where there's COVID-19 patients need to be educated on what type of mask they need to wear, when and how to wear it safely, hand hygiene and respiratory hygiene. And finally, we get to our very high risk job categories. And these are situations where workers are working with COVID-19 patients, but there are aerosol generating procedures being performed. So we are looking in a lot of cases in your emergency departments, your intensive care units, or perhaps even units that are dedicated to the care of COVID-19 patients, where you are, workers are involved in intubation, whether non-invasive ventilation or actual use of ventilators, sputum induction, many procedures that are basically entering into the respiratory tract and causing aerosolization of respiratory particles. These can also include dental procedures. So we need to be keeping that in mind. If there are dental services being offered somewhere, we really need to look at the type of dental surgeries that are being performed. In this situation, we go to our engineering controls with adequate ventilation, reducing the amount of people that are in these areas, and ensuring that the people who are working in these areas ideally are experienced and knowledgeable in the use of their IPC training, personal protective equipment, and again, we're keeping it as less crowded as possible. Workers need to again, be staying home if they are unwell, observe hand hygiene, and use appropriate PPE. And in these situations, the recommendation is that workers wear respirators, which can be N95, FFP2. It depends on the type of respirators that are available, and that they are trained in how to safely put them on, how to do their mask test to ensure that they're on properly, and that they also know how to manage them. So this takes me to the end of the presentation, and what I did want to highlight for you is in the resources listed here, and specifically the prevention, identification, and management of health worker infections, that we have a number of guidance that are available on detecting SARS-CoV-2 infections in health workers, looking at the types of surveillance you should be considering depending on the level of transmission in your community and your resources, looking at testing strategies, again, depending on the setting and the resources that are available, and health worker exposures. So these are all available in this particular guidance document, which is complementary to the occupational health guidance document that's been out there. And we also have posters and infographics available on our website related to these topics to that facilities can post to help inform people of the different measures that are recommended for ensuring safe health worker environment. And I think that's it for now, and I hope I didn't go over time, and thank you.
Thank you so much, dear Victoria. And with that, I'm becoming totally confused in our multilingual environment, and I believe we do have a question from one of the attendees. Let me recite it. So this is a question to you, Madam Victoria. Could you please explain whether or not regular medical masks are protecting enough the health workers in implementation of their professional duties, or should healthcare providers use some special protection masks? And if yes, then what? So, dear Victoria, let's make sure that the question was translated. And if you have the answer, please suggest.
Yes, thank you very much for that question. WHO recommends the use of the medical mask, so the regular medical mask for health workers when they are interacting with patients, of course, with SARS-CoV-2. And we have to remember this also, that the PPE that they should be wearing also includes eye protection, because we want to protect all mucous membranes. So you need eye protection, a medical mask, and then we move on to gown and gloves. And research is showing, and there are numerous pieces of literature out there that have been reviewed and included in the guidance that we have offered, that in most situations, yes, a medical mask will provide the protection that a health worker needs. Where we advise a higher level of protection, such as a respirator, which provides filtration of very, very fine particles, that is for the aerosol generating procedures. So if you are conducting aerosol generating procedures, such as intubation, handling patients who are on ventilators, doing procedures that involve collection of sputum, like sputum induction, bronchoscopies, that sort of thing, then we advise that you move, the health worker wears a respirator, or if they are in an area where these procedures are being performed. So if you're, for example, working in an ICU and you have a number of ventilated patients that are having these procedures that are being done, you should be wearing a respirator at all times. So I hope that helps clarify. And this is all really well described in the guidance document that we published on masks, and it's also in our rational use of PPE guidance document. Thank you.
Thank you so much, dear Victoria, for your extensive and highly detailed answer to the question and highly informative report and presentation. And with that, I'm happy to hand over to our next speaker. This presentation will be dedicated to different aspects of the prolonged use of personal protection equipment. And with that, I'm happy to invite Dr. Ivan Ivanov again from the headquarters of World Health Organization. And let me skip additional recitation of the credential, because Dr. Ivanov has already addressed our audience today. So if you are ready, Dr. Ivanov, we are all yours.
Yeah, thank you very much. That presentation flows nicely from the question that was answered, that was asked also about medical masks versus respirators. In general, personal protective equipment is intended as a last resort for protection and to be used for a short time. It is impossible to work 8 hours with a respirator. A respirator has to fit well. It has to be tight. It has to fit well. And 8 hours in a respirator, you can see the skin lesions here on the picture. On the left side, what is the result of wearing 8 hours a respirator? That's why WHO is very cautious about recommending respirators when there is actually other protective equipment, such as medical masks, which do not cause at least that severe damage of the skin. We also see a lot of skin damage of the hands from the frequent use of disinfectants, of sanitizers, of gloves, and these are contact dermatitis. These are different skin lesions, and they make very difficult for health workers to continue to work and to provide good quality of care. So therefore, some health workers may have allergy to latex containing gloves. Of course, they have to be provided with non-latex or neutral gloves. The personal protective equipment has to fit properly. It does not need to be so tight against the skin, against the face, but it still has to properly be fitted. And therefore, also for respirators, there are different sizes. There are fitting procedures for the respirators so that they are effective. And of course, avoid using over-tight goggles, which can damage the skin and generate fogging. And if health workers develop any skin conditions related to personal protective equipment or other skin conditions related to healthcare, they should be referred to professional consultation and treatment. Slide number 20, please. 20. Yes. The prolonged use of personal protective equipment also can lead to heat stress. Some people use full coveralls, like shown here on the picture, that are not necessary for protection from the virus causing COVID-19. These are designed for contact infections like Ebola, and they trap a lot of heat and sweat, and result in heat stress, enormous heat stress, even in heat-related disease. Therefore, WHO recommends the proper use of personal protective equipment, not overly load the workers with layers of clothes and layers of personal protective equipment that is not necessary. Providing safe and cool drinking water, and providing also rest in a cool area. And these are the recommendations on this site. I would like now to pass the floor to the next speaker, my colleague from the Regional Office for Europe, Dorota.
Thank you very much, Ivan, and good day to all participants. It's my great pleasure to guide us all through the main issues related to the use of disinfectants. Can we go to slide 22? The use of disinfectants is, of course, one of the critical elements of the infection prevention and control. But as disinfectants are designed to kill and inactivate pathogens, these are active chemicals, and their application may be associated with different adverse effects to the health of health workers. Ivan has already mentioned the issue of this contact dermatitis and other skin issues related to this. And in fact, other acute health effects related with the use of disinfectants involve also irritation of mucous membranes, irritation of skin, but can also result in wheezing, breathing difficulties, etc. In some cases, these repeated may be associated with chronic health effects. And it needs to be remembered that these adverse effects related to the use of disinfectants can occur at different stages of preparations of disinfectant solutions, handling of them, especially if the staff is not having appropriate personal protection equipment, also can be linked to unsafe storage, processing, or overuse of those disinfectants. These key points are mentioned in the joint WHO-ILO guidance, but more details can be found in a dedicated in a dedicated guidance on cleaning and disinfection of environmental surfaces published last year. And this is an extremely useful resource, which is providing a number of practical advices and recommendations. In many cases, it will probably be also a good reminder on the cleaning and disinfection practices, how to handle cleaning supplies, how to make sure that the solutions that are being used are really effective, what kind of products are to be used. And in the context of SARS-CoV-2 virus, the emphasis is on the chlorine-based disinfectants, and the guidance is providing some detailed advice on preparation of solutions to make sure that appropriate concentrations are maintained, and also is containing some comments on the use of spraying disinfectants and other no-touch methods, and I will come back to this later. In the context of healthcare facilities, we have heard about different types of risks for health workers, and we can also say that we are also having places in the healthcare facilities which are of different risks, and the guidance is providing some practical recommendations how to deal with the cleaning and disinfection in different places like patients' rooms, common spaces, kitchens, bathrooms, etc., to make sure that cleaning and the follow-up disinfectant practices are handled properly. And among the many components which need to be remembered when thinking of disinfection and cleaning practices, it is extremely important to remember about the proper order. So first, to thoroughly clean the surfaces, furnitures, touch switches, infusion pumps, stethoscopes, all possible surfaces prior to the application of disinfectants. It is critical for the effective application of disinfectants to have them in the right concentrations and to ensure proper contact time, following very closely the recommendations given by the manufacturers. It is extremely important for the effective disinfecting procedures. The same applies to the preparation of the solutions, that they need to be prepared and used according to the recommendations of the manufacturer, and that's relevant for their effectiveness on the surfaces and reducing the risk of damage to the surfaces. But from our perspective, even more important is that improper solutions, especially if in too high concentrations, they can create additional risks to the health of a handling operator. Thinking of occupational health and safety of workers involved in the development, preparation, and application of disinfectants, it is critical to remember that disinfectants need not only to be prepared as recommended by manufacturer, but they also need to be prepared in well-ventilated areas and should be stored in similar places. And it's very important to avoid combining different disinfectants, especially in an uncontrolled manner, given that there is a risk of creating solutions and combinations with the release of potentially toxic fumes and gases, especially chlorine. To do so, it's extremely important to have health workers involved in the cleaning and disinfecting practices properly trained and equipped. The workers need to have adequate PPE, and we have already heard that there might be different requirements for this protection equipment depending on the nature of risk area in which the workers operate. The workers need also to be provided with clear standard operating procedures and accessible information related to the preparation and use of disinfectants. And last but not least, the staff, workers involved in cleaning and disinfection need also to be evaluated and assessed whether they may have any health conditions which would exclude them from working with active chemicals. An important issue which many of you might came across in the context of healthcare facilities, but also other places, indoor and outdoor, is the use of spraying disinfectants, is the use of different fumigating techniques, both indoors and outdoors. And here, a couple of relevant points and the guidance from the WHO, that under no circumstances is WHO recommending spraying individuals with disinfectants. You might have seen images with different tunnels, chambers where disinfectants are being sprayed. This measure is not effective, is not efficient, is not providing protection. On the contrary, it can be harmful, both physically, but also psychologically to people affected. And it can also result in acute effects of exposure to toxic chemicals. I mentioned already that for the disinfectant to work efficiently, it needs to be in the right concentration, in the right location, and in the right time. So spraying disinfectants on the surface which hasn't been thoroughly cleaned is weakening its activity, because the disinfectant may be absorbed on dirt, on soil, or other organic matter. It will also not be efficient in those potentially hidden places where the disinfectant has no direct reach. Thus, also in the indoor spaces, spraying or fogging is not recommended for COVID-19. The cleaning and disinfectant practices for sure are well known to health workers. There are some issues of particular relevance that need to be highlighted in the context of COVID-19, but also in the context of other pathogens that may occur concomitantly. And there are also many resources to get updated and trained. And another open WHO course is on the standard precautions related to environmental cleaning and disinfection. And it is very easy to follow self-paced training that is touching upon several aspects of environmental cleaning and disinfection, primarily in the context of healthcare facilities. And it may be a useful reminder on the practices that would reduce the risk of adverse health effects of using of disinfectants for health workers. Concluding, I would like to sum up and repeat the key points and the key recommendations coming from the WHO-ILO guidance, that the solutions of disinfectants need to be prepared and applied according to the recommendations of the manufacturers, that these preparations need to be done in well-ventilated areas, and mixing of different disinfectants should be avoided. Health workers who are involved in both preparation and application of disinfectants need to be evaluated for their personal medical conditions. They need to be properly trained and equipped with the personal protective equipment and instructed so that they can use this equipment adequately. And that spraying of individuals with disinfectants is not recommended under any circumstances. Hopefully, creating these conditions and adhering to these recommendations will contribute to reducing the health occurrence of the health effects of using disinfectants among the health workers. Thank you, and over to the next speaker.
Thank you. Thank you, Dorota, for this interesting and comprehensive presentation. So far, we have no questions. However, there are questions to Ms. Victoria. So there was question to slide 16 from your presentation, Ms. Victoria. Why would health facilities use ventilators with HEPA filters without recirculation? And question number 2, also a question for discussion. What is the meaning of recirculation of air? Why would we use recirculation? If you could comment on that.
Okay, so I'm not a ventilation expert, and we did recently publish a roadmap for ventilation that's available on our website now. And I think health facilities should really take a look at this roadmap. It explains this very simply in terms of how ventilation works in a facility. But first of all, to give my best attempt, in terms of ventilators, what the actual ventilator, it is recommended that they have HEPA filters on them so that there is a reduced amount of virus being exhaled. So when you have a machine working and the air is coming out, that we have these HEPA filters in place. Different filters are available depending on the type of ventilator that you use. So it's very complicated. It's not easy to give us a simple answer because it really depends on the type of ventilator that is in use for a patient, whether or not you can put some sort of filtration device on it so that any air that is coming off of that ventilator is being filtered and reduce risk of any virus being somehow put into the air where the health worker is working. So that's that part. And again, we do have recommendations about the type of ventilation. So you want to make sure that you have a well-ventilated area, that you have filtration systems in place for ventilation in the health facility. And again, that you have systems that can be maintained. And there are guidance if you are running a facility where you don't have a mechanical ventilation system, then we do have guidance for natural ventilation. So looking at the design so that you have windows that are open and good airflow flowing through the organization so that you don't have air trapped in certain areas and potential for exposure to health workers to the virus. So again, I would really encourage you to go on our website, and we do have a newly published roadmap. I really like it. It's very simple. It explains the types of ventilation and what you should be looking for, and then provides some very practical options for enhancing and improving your ventilation if needed. So I hope that's helpful.
Thank you, Victoria. And also we had a question to Dorota. How does one assess these counterindications? How do we evaluate the health conditions? Should it be a checkup and should it be part of a planned checkup or not? How should this evaluation of health conditions organized?
Thank you for this question. I think this might be part of the assessment of the worker more in general. When you are going to take up some duties, some type of work, there is always this introductory assessment of the health condition and whether a person is suited to do some work. Here, in the context of disinfectants, we are mainly compelled to work with active chemicals and disinfectants. So this would be more general principles of the health conditions, especially chronic health conditions, which may be a contradiction for certain tasks like those related to the use of active chemicals.
Thank you. Thank you, Dorota. Now I see that we have no more questions at this point, and we
I would like to add something to that question regarding the assessment of the impact of the chemicals, because the chemicals also to be used at work, they should be accompanied with the safety data sheets where the risks of using those chemicals should be highlighted, as well as the safety measures that should be applied in case of misuse of such chemicals or the spillover of those chemicals. Moreover, in the context of the risk assessment of the exposition of the workers to occupational risks, including to chemical agents, that situation should be addressed. There should be identified what are really in all work situations, what are the risks of a worker came into contact with the chemical agents, and what should be the preventive and protective measures aimed at eliminating or reducing those occupational risk levels. Thank you.
thank you for this very interesting clarification. So, while we were preparing for the break, we had another question to Ms. Victoria. In health and prevention facilities, so the former epidemiological stations, can one use only face shields without face masks? Thank you.
So no, we are recommending the use of face masks as in addition to face shields. And the issue with face shields is they are actually specifically designed for protection of the eye against splashing or spraying. So they haven't really been designed for those fine droplets and aerosols that could be in the air and from close contact with a person who is coughing or sneezing or talking, you know, all of those modes of transmission. So the face shields aren't designed to protect from that. That being said, we know that things are evolving, and we are continuing to study this. But at this point in time, the recommendation is that if you are having contact with people who may have SARS-CoV-2 infection, you're a health worker, that you wear a medical mask. If you're in a situation, I should just clarify, if you're dealing with patients who have SARS-CoV-2 infection, you're wearing the medical mask plus the addition of either goggles or face shields, because as I did say earlier on, you want to protect all mucous membranes, so the eyes as well as the nose and mouth.
Thank you so much, Ms. Victoria. It's a very important answer, because we had a question from actual physicians. Now we have the next speaker. I'm happy to give the floor to Christian Wisco from the ILO. And Christian will present on workload, work time, and organization. Now, Christian, the floor is yours.
Thank you very much, Yuri, and welcome back to our exciting webinar. So we are talking now about the importance of well-organizing working time in conjunction with workloads and work organization. Why is this so important? This is to prevent fatigue of health workers. Fatigue and working long hours is said to, or is proven to, increase the risk of work incidents and accidents. And indeed, there is evidence that suggests working more than 12 hours increases the risk of injury for 37%. So it is really important to keep working time in mind when you organize your work, your shifts, and so on. The bottom line is, of course, the normal working hours in a health sector should be aligned with the national standards on working time applying to other workers as well. And as far as possible, normal working hours should be maintained. So the general recommendation is that the work week should not exceed 40 hours and the work day should not exceed 8 hours. Of course, in a public health emergency situation, such as the COVID-19 pandemic, this cannot be applied everywhere. But still, there are possibilities to prevent chronic fatigue and that is associated with risk of injury for workers, but also with, let's say, negative effects on patient safety. The baseline requirement for decent working time arrangements is that sufficient staff is there. So a long-term strategic health workforce planning is, and staffing levels, which in the health sector are safe staffing levels are a precondition to arrange for decent working time that prevent long hours. And we see in the COVID-19 pandemic a lot of long hours and heavy workloads being burdened on health workers because of the lack of staff in most countries. So when there are exceptions to the provisions on normal hours in the case of a declared public emergency, these exceptions should only be allowed on a temporary basis. Well, for the COVID-19 pandemic, this is an extended already period of 1 year, and this is extremely difficult, and fatigue accumulates as we observe across the world among health workers. So taking measures for the optimal organization of working hours, shifts, and rest periods should be aligned to the local context and situation and be as practical as feasible. Slide 30, please. Thank you. So some documents and there is guidance on how to arrange for shifts. Usually 5 to 8 hour shifts are tolerable, or 4 10-hour shifts. Longer working days, as I already said, are a risk factor for fatigue. So when you have a 12-hour, when you cannot avoid a 12-hour day, you should factor in frequent short breaks for health workers to take a sip of water so they don't dehydrate, have rest breaks. That's very important. Usually the shift rotation is better tolerable when it goes along the circadian system. That means moving from morning to afternoon to night. When working times are arranged, this should be done in consultation with the workers, bearing in mind their preferences and also the local conditions. It is also important to balance working time with the workload. So you have, of course, tasks that are very heavy and also emotionally straining, like if you are working in an intensive care unit, that is very stressful. So when there are longer shifts, they should be really arranged in a way that you are given lighter tasks, and where the work task is very heavy and very heavy workload and intense work, both physically and emotionally, you should opt for shorter shifts. So rest periods are very much important. Wherever possible, at least 10 consecutive hours per day of time off should be given. And it's good to factor in 2 days after 14 consecutive days of work at least. Frequent rest breaks, I already said, during long hours during long shifts is very important. And also factor in longer breaks for meals. 1 or 2 full days of rest to follow 5 8-hour shifts or 4 10-hour days, and 2 rest days after 3 consecutive 12-hour shifts are recommended to prevent fatigue. There's also, and we saw that in many countries, there are measures taken to provide accommodation for health workers during emergency operations for 2 reasons. The transport may be disrupted, and also health workers are very concerned about bringing the virus back to their families when they go home. So there should, of course, without saying, also be provisions for meals, for sanitary facilities, and also recreational opportunities. Let's briefly refer to violence, harassment, and discrimination. We saw, unfortunately, while the health sector, as I mentioned before, is one of the sectors highest at risk to violence and harassment. During the COVID-19, we saw an increase of harassment, violence, of discrimination and stigma that health workers suffer. So stress and fatigue, of course, are the most common factors, but also, and their work organization is very important. Patient flows that avoid long waiting times or crowding. These are all factors. Health workers have to do with people in distress, and of course that leads to stressful situations, to tensions that can escalate in harassment, in verbal abuse, and sometimes also in physical abuse. So when preventing violence, measures should be taken, not only protecting health workers at the workplace, but also considering the way to and from work, and also the work in the community, because health workers often go to the homes of patients. So there should be measures to protect health workers from possible risks. High-risk groups are those that are directly working with the public at night, and you should in any way avoid that health workers work in isolation. So make sure that there are always possibilities of providing contact that people at risk can call for help. Establishment of specific legislation and regulations to protect health workers against violence, harassment, and retaliation is really critical. And I mentioned the new convention that guides governments in providing legislation for that. But it should also come along with the adoption of community engagement and communication initiatives to really respect health workers, to prevent stigmatization, and to help create a trustful relationship between patients, community, and the health workers. Of course, the policies for prevention are key. Slide 33, please. So, ILO and partner organizations such as WHO, the Public Services International, and the International Council of Nurses already 20 years ago investigated in the workplace violence phenomenon in the health sector. We did research, and that research informed framework guidelines. And in those guidelines, you can see what measures can be taken. So a workplace policy is critical to set standards at facility level, but these should be, of course, consulted with the social partners and their representatives. Procedures to prohibit discrimination and to promote fair treatment of workers is very important. So a respectful work environment is the bottom line to prevent violence, and then also protecting health workers against attacks, but also promoting the mutual respect between health workers, patients, and the public. There are several engineering and organizational measures that can easily be implemented. All of these are shown in the framework guidelines. They are also addressed in the interim guidance we are discussing here. Providing alarm systems where it is possible. We see many health facilities where it is not possible. And there should be, let's say, a way to exit a situation. So health workers should also be trained in how to prevent risky situations, how to protect themselves, but also systems like the buddy system that the health worker is always in contact with another health worker when he or she works alone is very important. Of course, there is this OSH principle, occupational safety and health principle, that you should regularly assess the risk of violence and harassment in consultation, of course, with the workers and their representatives, and accordingly to the findings of such an assessment, measures should be taken both at facility level, at sectoral level across the health system, but also through national standards in fighting violence and harassment at work. Thank you very much for your attention.
Thank you.
Dear Kristen, this was a highly interesting, on the one hand, extremely important, and we are quite thankful to you, dear Kristen, for such an extensive narration. Please stay with us, because I'm sure we will have multiple questions and comments, which, for the sake of time saving, I suggest should be accumulated and presented at the end of the session to the full panel of speakers. With that, sharing the floor with Dr. Alisa Latibrizgalova from the World Health Organization Country Office to discuss with us mental health and psychosocial support. Dear Dr. Alisa, we are all yours. My dear colleagues, my warmest greetings. First of all, expressing my appreciation for the kindest invitation, let me invite your attention to read on the slide 35, please, which will help our discussion regarding mental health and psychosocial support in COVID-19 context, because in the last year, we all observed multiple instances and importance of COVID-19 effect on the mental health and the broad variety of factors of influence, such as anxiety, isolation-induced, social isolation outcomes, and other stressful factors, which, in case of health workers, is aggravated by additional stressor factors and agents. Many of them have been excellently outlined by the previous speakers, such as biosafety implications, working long hours, increased number of patients, and many others. Also, there are some personal risk factors involved, which are affecting mental health, and sometimes might be even causing disorders. Well, in case of female workers, this could be a female sex, lack of training, part-timing, being isolated, either in terms of quarantine, containment, or social distancing, having to attend to children who have to stay at home and not being able to let out to school because of the lockdown restrictions, and others, including the household management burden, which also might be quite important in terms of promoting or provoking mental status development. Looking into the association of COVID-19 with anxiety, insomnia, depressions, and also the burnout effect, which is quite common among healthcare providers in their workplace. So the problems associated with the mental health of the workers can lead to absenteeism, high rotation, and volatility in the workplace, as well as increased number of human errors, which might have negative outcomes both for the health associates and patients as well. That is why last year, WHO and ILO, together working with other partners, has developed a number of recommendations and guidelines in this sector, including healthcare providers as one of the priority groups. Many of them have been translated into Ukrainian, by the way, like for instance, the joint guidance, which was published together with the ILO, is a wonderful summary of actions and interventions which might help improving or building resilience of the mental health of the health workers and improving their working environment. With it, switching to the slide 36, let us look into some interventions and actions which can be implemented at facility level. First of all, we can be focusing on what can be done fundamentally, but let me focus on some particular practicalities, because first and foremost, high quality communication is one of the prerequisites. Timely update of information which is received from reliable sources, not only for the benefit of clinical workers such as clinicians and nurses, but also any other health worker involved delivering different functions. And such regular informational update and communication will be helping to release the tension and stressful environment. Otherwise, rumors, gossiping, unvalidated information will start prevailing, thus aggravating the negative trends building up to the stress. Additionally, it's highly recommended to perform rotation of health workers, just like my esteemed colleague explained before. When you're combining high stress rotation into low stress environment, thus releasing the build-up effect, and also providing the adequate duration of the working hours with the necessary intermissions for recreation, having a well-established spaces for people relaxation and rest. And also you should practice mating your less experienced professionals with highly experienced colleagues so that this will be mutually beneficial. And again, there could be some mental health specific interventions which are also listed here, which will improve mental health as well as physical health. Also, World Health Organization is recommending to establish open environment of communication and also to promote the culture of mental health among healthcare providers, who should be trained in the basics of stress management, as well as having access to psychosocial support and counseling when and if required by their peers, by their social environment, by community, and also having access to professional help and care when and if necessary. WHO has a number of tools recommended for the sake of screening, monitoring, and release psycho-emotional tension release. Well, quite recently, we have developed a training module package for health workers, which was used for training more than 500 clinicians and health administrators in the nearest months about the crisis management, including the COVID-19 induced, and also about the actions to be undertaken by health workers to cope with the stress. There are also helpful recommendations and advice for the managers and health administrators about establishment of their respective working environment within their facility. With that, recapping on what was reiterated in terms of importance by the previous speaker, suggesting that there's no healthy nation without healthy health workers, but physical health and mental health always come together. And thus, you can't be discussing overall health without mental health issues addressed. With that, I have the pleasure of finishing my humble contribution to our discussion and hand over to the next speaker. Thank you, dear Alyssa, so much. And just like I indicated, please stay with us because we are pulling together a compilation of questions to the panel of speakers under this session. And with that, I'm happy to invite Dr. Ivan Ivanov again to discuss the sanitation, hygiene, and recreational spaces. Dear Dr. Ivan, our attention is with you.
Thank you. That would be a short intervention on my side to highlight the importance of sanitation, hygiene, and rest facilities during COVID-19 in all health facilities for all health workers. First, it is important to have hand hygiene facilities at all points of care, such as designated areas where PPE they have to be taken off or taken on, in toilets, rooms for personal and menstrual hygiene. And we do recommend use of a hand washing facility. It is much better than alcohol, which is also, as I argued before, is harming the skin. But a use also of alcohol-based hand rub for a rapid disinfection of hands when the use of water and soap is not possible. But in addition to that, health workers should have access to rest and relaxation rooms, to safe drinking water, to toilets, to supply for personal and menstrual hygiene, for food and rest opportunities during working hours. And all these areas should allow for safe physical distancing and adequate ventilation. My colleague Vicky Wallet argued and showed you evidence that also infections occur because of the interaction, close interaction and close contact among workers, particularly in such areas where they can congregate. It is also necessary to designate toilets and space for personal and menstrual hygiene, specifically for health workers separated from those for patients and visitors, and establish daily cleaning protocols, ensure workplaces, equipment, workstations are clean and tidy, and provide facilities for health workers to change into their working clothes or out of their working clothes, so they don't have to go outside in work attire and attract the attention of the community and then be exposed to stigmatization, and in some cases even we see violence against health workers when they walk outside in the community with work attire. So it is also very important that in all health facilities there should be a professional laundering of work clothes, particularly those that are worn at the bedside and that come in contact with patients and patient environments, so that workers do not have to take these clothes home to wash them home, and that the quality of the washing cannot be ensured. And whenever necessary and possible, to provide temporary accommodation, hotels, motels, trailers, for rest and hygiene between shifts, as well as support for food safety, for food service, childcare, and recreational opportunities. And with this, I would like to pass on to my next colleague from the ILO.
As I can understand, Dr. Ivanov had to interrupt his presentation. So with that, I'm happy to hand over to our next speaker, Mr. Haim Hamzawi from the Department for Administration of Labor Inspection, Safety and Health at Work, International Labor Organization. Dear Haim, the floor is yours.
Thank you. Thank you very much. I will speak for shortly on occupational health services and the medical surveillance with a special focus on the role in COVID-19 pandemic. To begin this presentation, let's present the international standard framework concerning occupational health services. To remind you that international labor standards are legal instruments drawn up by the ILO's constituents, so governments, employers, and workers, and setting out basic principles and rights at work. These standards are either conventions or protocols, which are legally binding international treaties that may be ratified by member states, or a recommendation which serve as non-binding guidelines. And in many cases, the convention lays down the basic principles to be implemented by ratifying countries. However, related recommendation supplements the convention and provide more detailed guidelines on how it could be applied. So concerning occupational health services, the convention on this issue is the Convention 161, which was adopted in 1985 and is now ratified by 34 countries. Ukraine ratified the convention on June 2010. This convention provides for the establishment of enterprise-level occupational health services, which are entrusted with essentially preventive function and which are responsible for advising employer, but also the workers and the representatives in the enterprise on maintaining a safe and healthy working environment. The recommendation which explained and detailed the technical issues of the principles mentioned in the convention is the recommendation 171, and it details how the convention should be applied. Other convention, mainly 155 and 187, which are on occupational safety and health at work and promotional framework on occupational safety and health, refers also to Convention 161 and other specific conventions, mainly conventions on mines, constructions, make reference to Convention 161 or specify the specific role of occupational health services for specific risk or a specific sector. The convention and the recommendation define the occupational health services. As mentioned, they have an essentially preventive function, so their role should be a proactive role on assessing hazard at work, evaluating risks, and avoiding as much as possible exposure of workers to this risk. They have to advise the employers, the workers, and their representatives in the enterprise about the requirement for establishing and maintaining a safe and healthy work environment and the adaptation of work to the physical to the physical and mental capabilities of workers. The convention and the recommendation defines only the functions of occupational health services. These include identification and assessment of occupational risks, the surveillance of the factors in the working environment and working practices, advice on planning and organization of work, participation in development of programs for the improvement of working practices, the advice on occupational health, safety, hygiene, ergonomics, and individual and collective protective equipment, the surveillance of workers' health in relation to work. So the surveillance of worker health can occur at several steps. The health assessment of workers before the assignment to specific tasks, which may involve danger to their health or the health of others, but also the health assessment at periodic intervals during employment, which involves exposure to a particular hazard to health, a health assessment on resumption of work after a prolonged absence for health reasons for the purpose of determining its possible occupational causes, recommending appropriate action to protect the workers and determining the workers' suitability for the job and needs for reassignment and rehabilitation, if any, and also the health assessment on and after the termination of assignment involving hazards which might cause or contribute to future health impairment. Occupational health services have also to promote the adaptation of work to worker and contribute to measures of vocational rehabilitation. They have also to collaborate in providing information, training, and education, organizing first aid and emergency treatment, and participate in analyzing occupational accident and occupational disease. How to organize these occupational health services to respond to all the function described in the international labor standards and in the national legal frameworks. The organization may differ from countries. They may differ also depending on several factors. The most important is also the size of enterprises and also the availability of human resources to conduct the missions of occupational health services. So in accordance with the national conditions and practice, occupational health services may be organized by undertaken or group of undertaken concerns, by the public authority or official services, by the social security institution, and also by any other bodies authorized by the competent authority. And we can, and in a number of countries, we have a combination of all this form of organization. In general, in large enterprises, or large enterprise opts for single undertaken services. For example, in health sector, university hospitals with large number of employees have their own occupational health services. However, SME mutualized on a common service with different organizations varying from country to another. Occupational health services should also be made up of multidisciplinary teams, as they have responsibilities and functions dealing with medical, but also with engineer, ergonomics, and other competencies and specialties. So the composition should be determined by the nature of duties to be performed. They should have sufficient technical personnel with specialized training and experience in fields as occupational medicine, occupational hygiene, ergonomics, occupational health, nursing, and other relevant fields. The national legislation should ensure the professional independence of the personnel, but also the professional secrecy as regards both to medical and technical and industrial information. Which is also which is very important in a national system, is to ensure the interaction between occupational health services and primary care services, and to get this complementarity and integrative approach between public health and occupational health. This will be an holistic approach, looking at individuals in the context of their life. This will be will allow also access of all workers to essential intervention and basic health services, and focus on improving individuals functioning in work on other aspects of life, and not only on disease outcomes. So the occupational health services recommendation promotes the provision of curative and general healthcare services as a function of occupational health services, where they are found to be appropriate, and based on the national legislation and practice, the occupational health services may undertake or participate in one or more of the curative activity with regard to occupational illness. They are also have to participate and to be associated to specific preventive activities, like carrying out immunization, take part in campaigns to protection of workers' health, and collaboration with health authorities within the framework of public health. So what role for occupational health services in COVID-19 response? The first role is to proceed to health assessment of workers, and to match between the assessment of health status and the workplace risk assessment. Occupational health services have also to provide instructions to workers, but also advice to employer to advise them on the best way to respond and to protect their workers from COVID-19, to implement and to carry on training on prevention of COVID-19, but also to report and investigate cases of exposure and other accident and incident, including violence and harassment. They have also to advise on the procurement of safer technical devices and adequate PPE, and to organize the monitoring of health workers for COVID-19 symptoms and testing. In response to COVID-19, occupational health service have to get a holistic approach, going beyond the biological risk. And as was mentioned in previous presentation, COVID-19 causes not only biological risk, but also other related risks like chemical risks, psychosocial, musculoskeletal manutensions, and risk in relation to shift hours. To finish this presentation, and now that we are on the phase of initiating or of accelerating the campaigns of vaccination around the world, and mainly for health workers. Occupational health services have to play an important role in this campaign of vaccination. So their role is to identify priority groups based on workplace risk assessment and medical conditions, to inform workers about vaccination, about the benefits, but also about the risk, the procedures. They have to provide advocacy and orientation regarding vaccination, and to organize, and in a number of countries they participate to the organization of the immunization campaigns and recording of vaccination status. And the last role is to provide vaccines under specific condition which allow legal protection for the occupational health service staff. Last role is also role of pharmacovigilance and reporting of vaccine side effects. So thank you very much for your attention.
Thank you so much. Thank you so much for this interesting presentation. Now we move to the next presentation. It would be the last one in this session. So Mr. Antonio dos Santos, and he will present on responsibility for occupational health in the workplace. Antonio, the floor is yours.
Thank you, Yuri. Good afternoon to all. Thank you for the invitation and the opportunity. We are a bit behind schedule. I will try to speed up a bit the presentation in order to give more room for a Q&A. I will jump into slide 49 regarding the main applicable international and European labor standards. The European labor standards are also mentioned here because, as you know, Ukraine signed an association agreement with the EU, within which Ukraine undertook to align its national legislation, both in labor relations and also on OSH, with the EU acquis. Many international labor standards were already mentioned either by my colleagues Ralim Ramazouli, also by my colleague Christine Wisco, so I would not lose too much time on it. I would just stress the ILO Convention 155 on occupational safety and health and work environment that establishes the basic obligations of the states, of the employers and the workers on OSH. Also the more recent one, Convention 187 of 2006, regarding the promotional framework for occupational safety and health, which is focused on laying down the principles for framing national policies, national systems, and national programs on occupational safety and health. Also, the ILO Convention 161 on health services that was referred to by my preceding colleague. Also to draw your attention to the ILO OSH 2001 guidelines on occupational safety and health management systems, and also to not only for the Convention 149 on employment and the conditions of work and life of nursing personnel, but also to the two occupational safety and health EU directives, mainly the Framework Directive, which is the basis of the EU framework on OSH, which is the Directive 89391, that establishes the main obligations of the employers and workers when regards to OSH, and also of the member states of EU. regarding Ukraine, I would stress, considering this association agreement of Ukraine with EU, I would stress the importance, the paramount importance of Ukraine really transpose the EU Framework Directive on OSH 89-391. I remember that Minister of Economy is now drafting a law on the occupational safety and health of workers, which is under consultation with the social partners. That is very, very important, because it is very important to shift from the current approach to WASH, which is basically a protective, corrective, reactive approach and compensatory approach, to a new type of approach, to shift to an approach based on prevention and on risk assessment and risk control. Also, and considering that Ukraine has a high prevalence of undeclared work and informal employment, inclusively in the health sector, it would be very, very important to align national legislation with ILO recommendation 198 on employment relationship. And I recall that within the Ukrainian parliament, there are 2 draft laws that are aimed precisely on aligning national legislation with ILO recommendation 198 on employment relationship. And that is crucial. Let's move to slide number 50, where we try to summarize the main employers' responsibilities within the international and European labor standards. And the main employer responsibility is to ensure the safety and health of the workers in all aspects of the work, with strict compliance with the general principles of prevention, which are laid down on the right-hand side of this slide. And basically, what the employers have to do is to, in consultation and cooperation with the workers and their representatives, to establish a continuous improvement cycle of risk management, which is based firstly on avoiding the risks. When the risks cannot be totally avoided, to assess those risks, and then to devise and implement the most appropriate preventive and protective measures in order to either eliminate or reduce to acceptable levels the risks, the occupational risks. And then, after the implementation of the measures, reassess the risks in a continuous virtuous cycle. That is basically the most important obligation of the employers. And it's not just regarding COVID, it's regarding all occupational risks. And that also implies the need for the employers to ensure the conditions that are necessary to maintain this system working properly. And that is, for example, to set up and to provide the necessary means to ensure the functioning of occupational safety and health services at the work floor level that my colleague talked about, and that really are foreseen on ILO Convention 161. Besides that, the employer also has the obligation to provide information and training to the workers. Information, for example, in the case of a specific case of COVID-19 pandemic, information on COVID-19 technical updates and tools to triage, to test and to treat patients, information on clinic protocols, on guidelines, on occupational risks that the workers are or might be exposed to, on information on the most adequate preventive and protective measures to ensure safety and health of the workers in relation to those risks, information on self-assessment, on symptoms, and on reporting and on reporting of symptoms, and on information also on policies for staying home if a worker shows symptoms of COVID-19. Also, to share information on infection prevention control, and not only for the workers, but also for the patients and for the public in general. As for the training, it is important that employers ensure adequate training to workers, to health workers, as well as to other workers, in particular regarding risk assessment, regarding the preventive and protective measures that should be applied, the use of work equipment, for example, the use of personal protective equipment, etc. Also, employers should ensure the consultation and the participation of the workers, not only on the risk assessment, but in all decisions that has to do with their occupational safety and health. In particular, of course, regarding the occupational risks to which they are exposed and the measures that should be taken in order to prevent them. Also, employers has the obligation to ensure emergency response and the establishment, the necessary contacts with outside entities that are critical for dealing with such emergencies. Also, employers have the obligation to ensure workers' health surveillance, including mental health and the counseling. And it is important to stress that this health surveillance is not just the admission medical examination to check if a candidate is fit to the job to which he applies. Is also aimed at monitoring the health of the workers and the impact of the work they do and the conditions under which the work is performed on their health. It means that they should be, depending on the risks to which they are exposed, and that depends and results from the risk assessment, to establish the periodicity and the frequency under which the workers should be, under which the health of the workers should be examined and monitored. And then, of course, depending on those health examinations, other examinations and other frequencies can be defined by the occupational physician. Also, the employer should have the obligation to provide the means necessary to prevent and protect the safety and health of the workers, in particular, providing collective protective equipment, infection prevention control, and also personal protective equipment. And here I would like to stress something that Ivan Ivanov already reflect on, and which is that the personal protective equipment is the last resource. The last resource. It is not even a preventive measure; it's a protective measure. Preventive measures are the ones that are aimed at avoiding the damaging situation to occur. Protective measure is the one that is aimed at minimizing its consequences. And the PPE is aimed at minimizing the consequences of the exposure of a worker to an agent such as this one. And if you look at the slide number 50 on the general principles of prevention, you will see that within these hierarchical and sequential principles of prevention, which are laid down on Article 6 of the OSH EU Framework Directive, the provision of collective and protective equipments are lower. Are the last measures that should be taken. First, the risk should be avoided at the source. And then, of course, the other preventive measures should be taken in sequence, and the last resort would be to provide PPEs, because PPEs themselves create additional risks. as we already saw by the of our colleague Ivan. So let's move on to slide number 52. Workers, of course, have right to decent work, as we already heard before from our colleague Christine. They have, of course, right to fair income, to equality and non-discrimination. They have the right to participate and to be consulted on the decisions regarding their loss. They have the right to safety and health working conditions provided by the employer. And they have also the right, which is foreseen on ILO Convention 155, to remove themselves from situations in which they are exposed to imminent and serious dangers to their life and health. And that right of the workers should be respected by the employers. As for workers' responsibilities, you can check them on the slide 53, please. Of course, workers should use the protocols to assess, triage, and treat patients. They should provide info to patients on infection prevention and control, and on public health. They should treat patients with respect, dignity, and compassion. They should also follow the established OSH and public health procedures. They should participate on the OSH trainings provided by the employer. They should be the first ones to take care of their own health and the health of the persons that could be affected by their actions or omissions. And also, they should self-monitor their symptoms and report the exposures. But here it is important to also understand that the employer should have the responsibility to ensure an environment that allows workers that encourages workers to report situations of infection, because otherwise they will not feel comfortable in reporting such cases, and that is very dangerous. Also, workers should use and dispose correctly the personal protective equipment. They should report situations in which there are serious or imminent risks that cannot be avoided. Also, they should cooperate with the employer and workers with OSH responsibilities. I would like to stress, and I would ask you to go a bit back to slide number 50, because there are some other employers' obligations that I passed through, and I would like to get back to that because they are critical. And that is to stress that the one aspect that Christine already pointed out, which is the obligation of the employer to ensure a proper management of the working time according to national legislation, and that means regarding the maximum daily and weekly working time, the minimum weekly rest and daily rest, breaks during, because the idea is to reduce the duration of the exposure, the frequency of the exposure of the workers, and the dose to which they are exposed. And working time might also be a very important instrument of managing this exposure. Also, it is important to stress the obligation of the employer to report occupational accidents and diseases, and to ensure the coverage of the workers by employment injuries benefits. Also, the obligation of the employer to cooperate with other employers that have workers on their own premises in order to coordinate the risk management at each workplace. Also, it is important also to ensure to point out that the employers have also the obligation to ensure a safety and health environment free of blame, violence, harassment, and stigma, which has already, as Christine already pointed out, are situations very common on the health sector that should be addressed, and the most recent ILO Convention 190 on violence and harassment should be, of course, applied. As for the responsibilities of the state, well, state, as we all know, is one of the main employers, which is particularly true in Ukraine, and especially on the health sector. So besides the state responsibilities as an employer towards its workers in terms of OSH, and those are the ones that were mentioned before, state has also the highest responsibility for the promotion of the continuous improvement of occupational safety and health in the country, and also to prevent occupational injuries, diseases, and death. Also, the states have the obligation to formulate and implement a national policy for OSH, a national system for OSH, and also national programs for occupational safety and health, including a national program for occupational safety and health for health workers, as laid down by Ivan Ivanov on the beginning of this session. Also, states also should secure, as employer, besides the obligations that we've seen before, that the health workers involved in COVID response are covered for medical care, sickness benefits, including testing, vaccination, and treatment of COVID, quarantine, and isolation. Also, the state should also assure that health workers covered by employment injury benefits, especially when victims of occupational injuries or diseases regarding the infection with COVID, including health care and compensation during the period of incapacity to work, and when appropriate, covering also dependent family members. And finally, as already Ludmila from State Labor Service mentioned, it should be considered, and it was a year ago. There was I suppose a CMU decree, that establishes that in which conditions the infection with COVID is considered an occupational accident, and with the relative consequences in terms of benefits and treatment. But it's not enough, because the procedure, as we have seen, is far from perfect on its implementation on the ground. So it should require additional attention to see how it could be streamlined in order to really ensure a quick inquiry of the situations of work-related accidents or diseases related to COVID, and a quick intervention from the state to support the infected workers. Also, it should be considered an update on the list of occupational diseases, exposure criteria, and reporting. And that's all. I will give back the floor to our facilitator in order to open the discussion for Q&A. Thank you so much for your attention. It was a pleasure to be here. Thank you.
Дуже дякуємо. Дуже дякую, пане Антоніо. Це було дійсно дуже.
Thank you, dear Antonio. This was highly interesting, highly detailed, and I'm sure most constructive and instrumental for the benefit of our audience. And with that, kindly addressing all of the panelists under the session and attendees, we are skipping the break for the sake of time saving, and thus we are continuing to another item in our agenda, in which will include the close-up session and the Q&A element. So please stay with us, be sound, be well, stay put and attentive. And with that, I share the facilitator's honorary responsibilities to Mr. Joachim. So now it's over to you to proceed.
Thank you so much, Yuri. I'd like now to show the slides where we have some additional information on some tools, publications from the WHO and the ILO, which may be useful also to address COVID-19 and other occupational hazards in the health sector. And I'd like to invite our colleague Ivan to take the floor and start with the tools from WHO. Ivan, please.
Thanks a lot. Slide 56, please. Well, I will be very short. I'm sure the organizers will share these PowerPoints with the participants because they have a lot of links that you can click in and get into the direct content. But WHO has prepared a lot of online courses and training tools, either WHO or also together with the International Labour Organization, on different aspects. I mentioned already the occupational safety and health for health workers in the context of COVID-19, and we would really welcome translation to Ukrainian, to Russian, to other languages. We have also courses on respiratory protection, personal protective equipment, infection control, masks, standard precautions, and the ILO WHO course on work improvement in healthcare facilities, also checklist by WHO for health workers and for risk assessment and management of infections, of exposure among COVID-19 exposure among health workers. That's on my side. Thank you.
Thank you, Ivan. So I'd like to have the next slide, please. And I'll also be very brief. There you go. So this is just a list of tools that you have available on the ILO's website. Again, the same invitation, namely to our colleagues in Kiev, if you want to translate these publications into Ukrainian. Of course, you just have to let us know. So we have, I would say, the two best sellers among all of these tools are the one, a manual on how to address mental health and psychosocial risks during COVID-19, which is a manual which provides in 10 different chapters very practical steps for employers and for workers on how to prevent and address the effects more on the mental health when facing the current pandemic, namely for those that are providing essential services, but also for those that are teleworking. And the other one would be our guidance tool on a safe and healthy return to work, which is divided in two different parts. The first one with recommendations for governments and social partners on how to define national policies and sectorial policies for a safe return to work. And the second part, more addressed to workplaces, so employers and workers' representatives, also on how to implement prevention measures to avoid infection at workplace level, but also to address other occupational safety and health issues that may arise out of the fact that many workplaces will suspend operations and they may reopen without providing for correct maintenance, etc., etc. And with this being said, I would move immediately to the questions and answers section. So with the help of colleagues, we went through the many questions that we have received, and we have selected two. And I'll ask both colleagues from WHO and ILO to respond to these questions. And I would start with the first one, which is exactly on the mental health. And the question is as follows. How can we avoid professional burnout in the health sector? So what concrete steps can we do in a way to avoid burnout for health professionals? And I would like to ask this question to Alisa from WHO, and then if Halim from the ILO would like to add something, I'd also ask him to take the floor. Alisa, please go ahead.
Thank you so much for a highly interesting and equally important question to disclose. First and foremost, we have to learn how to care for ourselves. to be good carers for the others. Because once we have our fundamental needs met, once we are safe and certain about sufficient time to relax and recreate, sufficient food to provide yourself with nutrients so that you will be physically apt to delivering your function, then you'll be mentally and psychologically prepared to survive that, and such resilience will prevent the burnout naturally. Also, there are helpful recommendations about use stress prevention interactions, habits, and behaviors. For example, quitting smoking. That might be a very helpful step forward towards strengthening your overall physical health, including the mental aspect. Also, we should be mindful of abiding by the rules, implying that every day you should exercise some socially and personally important activity, which might be a jog in the park or some creative exercise which might really help you release your artful beginnings and thus provide for your stronger psychological resilience. Then different types of mutual support, peer support, family and social support, that is equally important as well. Whether it's part of your routine day or whether you have it before or after day, particularly involvement in some family significant or community significant events, so that you will become the tangible part of the society, so that this could be both mutually rewarding and self-rewarding in terms of engagement. Not limiting your entire performance and your entire fatigue depreciation to the professional part of your performance alone, and as well sharing as much as you can with your peers, with your family, with everybody else. Being conscious of what you experience and survive, sharing what you experience and survive, sharing what you would be willing to experience and survive in terms of your plans, your aspirations, whether it's professional or non-professional setting and situation. Everything which falls within and beyond your immediate area of competence is important to be shared the equal attention and capacity. And of course, speaking of professional engagement, you should clearly realize what is within your professional and positional capacity and what is beyond. Because if you assume additional burdens beyond your capacity, beyond your area of influence, beyond your area of responsibility, then that might be a direct way towards burnout, and that should be prevented. Again, there are so many different modern techniques about tension release, stress prevention, breathing techniques, relaxation techniques, grounding techniques, emotional distancing from negative thoughts and ideas. There are so many of them. Meditation and mindfulness. All of such techniques are well described, well publicized, and well accessible in a reader-friendly and user-friendly format. Many of them have been presented in one of the latest WHO publications, which has been translated into Russian and, by the way, into Ukrainian, so it's ready for you to use in Ukraine, including healthcare professionals. Also, please be mindful that whenever you are not successful in managing your stress independently, or any kind of tension, even before it aggravates to the stress, then do please address a professional. Do please consult with those who can help you with in terms of mental or psychological support. So with that, I hope I covered the response to this question quite extensively. If not, then ask me for comments and details. Thank you, moderators. Your microphone is muted.
I was thanking Alisa, and I'll be sure to apply your recommendations to myself. I'd like to ask Halim, Dr. Halim, if you want to add something as well.
Thank you, Joachim. I think that Alisa gave the important point to manage stress, but to avoid also to be on a burnout situation. What I have to focus on is to get a balance between professional life and personal life to manage stress, maybe for health workers, and to get assistance in managing the stress, as in general health workers are not often good clients. Let's say it like this, are not a good client for a stress counselor or for a psychologist or psychiatrist, and also to provide training in stress management, but also to identify early signs of burnout, like insomnia, loss of vital momentum, and to finish, also don't hesitate to go in leave, mainly when we have hard tasks and when the tasks are busy. And we know that with COVID-19, there's hard and very heavy tasks for occupational, for health services, and mainly for intensive care. And this is also the responsibility of the worker, but also the responsibility of the manager to manage leave of his staff, to avoid presenteeism and to avoid to go on severe burnout situations.
Thank you, Alim. And speaking about leave, I can see here Christian. What about the working hours and organizing the working times? What's the relation of this with potential burnout, Christian, and how to avoid it?
I agree. Thank you, Joachim. I agree very much with Halim that health workers are not very good in caring for themselves, and I think it's rather a positive sign. So that is why it is so important to combine collective measures at the workplace to really look into work organization, like working time, to prevent coming into this fatigue, because fatigue is the first step into burnout. And I attended once a seminar on burnout, and one of the instructors said, well, it's actually not a weakness to get into burnout, but it's mainly those who are most committed to their work, who are really passionate workers. And most of the health workers are these committed and passionate workers and forget about themselves in the caring for their patients. So sometimes we need somebody to care for the care workers, and I think everybody here on the panel is really taking this task on board. Really promoting the protection of health workers is so important, and they need our support. Thank you.
Thank you very much, Christian. So the second question will go to Ivan. Again, to you, Christian, and then I also like Antonio, to come in. So we heard we heard about many different practices in terms of preventing infection or the spread of infection in workplaces in the health sector. But what would be your, let's say, final words in terms of what is really the most effective when we think of health facilities? Maybe you will start with Ivan. Ivan, please.
Yes, it was, I will emphasize again on the hierarchy of preventions that were for prevention of hierarchy of controls that was presented early in the slides of my colleague Vicky Willett, how to apply the hierarchy of controls with regards to exposure to pathogens. And the most effective is the good collaboration between the specialists on infection prevention and control and the specialists on occupational health in healthcare facilities. And for that purpose, you need to have both of them. We are aware that many healthcare facilities do have people responsible for infection prevention and control, but when it comes to the medical examinations of workers, the vaccinations of workers, the reporting of occupational infections and the preventive measures, then it is really the role of occupational health and safety experts. So this is extremely important to have decent systems in place in all healthcare facilities.
Joachim, you're mute.
Technology, always the challenges. So I was saying, thank you, Ivan. Your answer was so complete that I'm not sure if Christian wants to add something. Please go ahead, Christian.
As I'm not an infection specialist, but I think what's very important and should not be underestimated is the need for ongoing training. Like what Victoria presented. I learned a lot about disinfectants from this presentation. So training and considering really well who needs this training. And as Ivan in the beginning said, we are not only thinking about doctors and nurses, but what is a health facility without a cleaning professionals? And those need to be trained properly for the specific needs of hygiene in health facilities. But then everybody of us, of course, needs to be aware about all these hygienic measures and there are some simple tasks, and we need to be really reminding ourselves how important it is to frequently wash the hands and keep the distance and wear the masks, even if it is annoying at times, but it's really important for us and for our patients. Thank you.
Thank you, Christian. And the last question before closing the panel is a surprise question to my friend Antonio. Antonio, you have been working with the reform or assisting our constituents with the reform of Ukrainian legislation. So what is the most effective options for the legal framework in terms of addressing challenges such as COVID-19 or other, upcoming potential pandemics, epidemics, public health crises, or events that may cause major disruptions in workplaces? Please go ahead and very, very, very quickly, please. You are mute, Antonio. You are mute. Antonio, we cannot hear you.
I would like to compliment our predecessor, our preceding colleagues, by adding the provision of the necessary means, the provision of information, and most especially the involvement and the engagement of the workers, their participation and their consultation on finding the best solutions for the risks to which they are exposed, because they know them better. So as for the next one, I would say, Joaquim, risk management. That is really what lacks in Ukraine. When you look at the current labor protection law, I would say that the most important thing that is lacking there is, for one side, the implementation of a new approach, an approach focused on prevention rather than on compensating the workers for being exposed to hazardous and dangerous working conditions. Instead of paying them more for that, is really to prevent them from exposing them to those working conditions. So to shift from a protective, compensatory, and reactive approach, change it for a preventive approach based on risk management. And the second one is really aligning national legislation on labor inspection with international International Labour Organization Conventions 81 and 129, because labor inspection is seen as a public authority that is there to find employers. That's it. And it's not that. We both know that. We all know that labor inspection is much more than that. is providing technical advices and information to employers and to workers and their representatives on how they can really improve working conditions. Is to provide support to the governments to develop or to improve their laws. And it's not just to fine, no. So I would say that what is needed is these two main aspects. Thank you, Juki, for the opportunity.
Thank you, Antonio. And I think Sophia wants to say something before the closing statement. Sophia, please.
Good afternoon now. Let's make sure that I am in the right channel and whether I unmuted myself. So please confirm that you can hear me well as you can hear the translation. Okay, so we have the thumbs up. We are okay to proceed. Thank you. Okay, I have thumbs up, I have a plus. I hope that's a plus into my karma. With that, please share the screen sharing function with me, because there were so many different questions. Where can we find sources, source documentation, materials, and references? So instead of providing verbal instructions, let me provide you the on-screen instructions and links. Okay, I have been shared with the co-host functional. So with that, I start broadcasting to make sure I can forward your attention to the link, which has all of the necessary helpful resources. So first of all, in order to have standing access to the information which we shared under the auspices of preparation, implementation, and follow-up to this event, our project has established a special web page in the website of our project. So please copy this reference link, and then you can paste it into any browser of your preference. I will copy it to the chat. So whenever you visit our website, you will find this section. By the way, you can use either Ukrainian or English language version. So here you will find two new blogs, COVID and OSH. The first one provides some general guidance and recommendations, both for employers about the safe return to work and other helpful materials that Joachim has emphasized the importance of, including the Ukrainian language translations, other materials for trade unions, for employee organizations, and also here we have records of our previous webinars. Once you go back and visit the other topical section, then here you will find information targeting different sectors or particular occupations. So here, for the sake of our subject today, we have healthcare sector and healthcare workers. So here you can download the latest edition of the interim guidance translated into Ukrainian. Also, here you can find the section where we uploaded extra materials, including Lyudmila Harchuk's presentation, for example. It's already available for download. Also, we have the joint presentation by Ivan and Christiana, and also the co-presentation of the interim guidance content, which was jointly done by our esteemed section. The record of our today's webinar will also be uploaded here. It will take some time, so please stay tuned and follow up with us. You will be prompted with the link. So all of the expertise accumulated today will be safe and sound and made available for your use and also for sharing with other colleagues. And with that, let me once again thank you for your kindest assistance, attention, and attendance. And with that, back over to Joachim, please.
Thank you, Sophia. So I think it's now time to close the event. So I'd like to call to the floor Mr. Guillaume Simonian from the WHO country office in Ukraine. Guillaume, please, the floor is yours.
Thank you, Joachim, and thank you, colleagues, for this very important, very useful, and I hope for the participants in the group today, very insightful seminar. And I would just like, by jumping on the point that was said in the last session, when you get close to the point where you see that your psychological state of mind is not at the right place where it should be, And as Alisa was saying, we as healthcare workers, we are on the front line and we need to take care of ourselves, to take care of others. We must all take this advice very seriously. And as for me, I will be on leave end of next week, and I'm very happy about that. And I recommend you all to take leave when you feel that the level of tiredness is getting to that level. But beyond this apartheid, it's true, and in this webinar, we have all through seen the very big stress that healthcare workers are subject to, psychological distress, constant fear of being very close to the disease in the daily life, separated from family with long hours, social stigmatization. You are close to the virus, so people want to get less close to you, and that's also very important in a state of mind. 1 in 4 healthcare professionals reported depression and anxiety, and it's not something to take lightly. It's something to take very seriously. Many suffer insomnia, many suffer those side effects that Alisa and others were, and Dr. Khalim as well were highlighting. So we must take the bull by the horn and work on implementing the interim guidance of WHO and ILO. And I hope that through this webinar, we've given you the gist of it towards the path to make it happen. We see also alarming rise in reports of verbal harassment, discrimination, physical violence, skin lesion. Healthcare workers are more than anyone else wearing the type of PPEs which are harmful to the body when you have them long enough, and we've seen pictures shown through this webinar. So we must ensure that all working people have decent, healthy, and safe working conditions, and it starts with the healthcare workers, which are making others safe and healthy. So I won't be too long here, but I would just like to end with the same point as was highlighted by the colleagues from ILO. We should, and hope we will, at the end of this webinar, embark on the path of developing and implementing this comprehensive program for occupational safety and health of health workers at national level and also at facility level. I'm saying both because we see too often very nice decrees, very nice strategies which are not being implemented. This one will really need to get to the end point, to the delivery point, and to make a difference in the life of our healthcare workers. Close collaboration is needed between all sides of the equation. The labor inspection was mentioned. It is one very important part of it. The managers of hospitals were mentioned. They're also a very important element of the equation. The healthcare workers themselves have to also learn to take care of themselves and learn about their rights and the obligation of the state. The state has those obligations which need to be turned into strategies, legislation, and action. The infection prevention and controls are practical things that we can do right now to improve the physical safety at healthcare facilities. So all of these things, I hope that we'll be able to package them together into this nice and helpful program on HOSH that we are all calling for in this meeting. And I hope that we have provided the insights, the tools, and the global evidence and the vision that is required for Ukraine and for healthcare workers. So thank you very much. Take care of yourselves, take care of the patients, and we'll make Ukraine a healthy place to be, including for healthcare workers and for all workers. So thank you very much.
Thank you, Guillaume. So just colleagues and dear friends, just a couple of words also from my end to close the event on behalf of the ILO. Of course, I couldn't agree more to what Guillaume just said, namely in terms of the need to move forward with this national program to address the specific needs of the health sector. And I know that the ILO is there to work with you, and I'm sure that our colleagues from the WHO will say the same. So I'd like to thank you all for organizing this event, this quite important event. I would like to join me in applauding the team that has put all of this together. This requires lots of work, as we know. I would also like to say that we are following from the ILO with interest the very good progress being made in Ukraine in the fight against COVID-19, and of course in relation to the health sector. I would say that, of course, this is not an easy battle. It's not an easy battle for workers. It's not an easy battle for employers. It's not an easy battle for governments. And because the responses are so complex, this requires dialogue, and joint commitment, joint action from all interested parties. So we have seen in the ILO that as we work with so many countries, that the countries that are more advanced in terms of preventing contagion at workplace level are the ones where we see more engagement in relation to governments, employers, and workers' organizations. So we are seeing in recent crises that the best solutions are found through social dialogue. This has worked very well in the past. I'm sure that this will work very well to face the current pandemic. I'm sure that this will work very well as well in Ukraine. So we have overcome many crises in the past, and again, we will overcome this crisis in Ukraine by working all together. So with this being said, I'd like to wish you all a very good weekend. Thank you all for being there. And again, do count on us for any support that you may require in terms of making policy and law into practice. Thank you very much.
Many health and care workers are working long hours with heavier workloads and insufficient time for rest and recuperation, resulting in chronic fatigue. At the same time, they are coping with the fear of contracting the disease and spreading it to their families and others. In addition, incidents of violence and harassment against health workers have increased during the pandemic, as well as stigmatization and discrimination.